Come here, Boo. Boo, you look so good, Boo. Boo, you look so good, baby Boo.
Stella, Splash, Simba, Boo, Sammy, Richard, Nancy, Goldie, Ziggy, Ringo, Eva, Hydrox, and Ditto, the Lucky Ferals.
It is 12:39 a.m. There's Ringo. He's looking out the window. And I think that's Ziggy. She's looking out of this window. And I just got back from the animal hospital, I don't know, 10, 15 minutes ago. And I just gave all the cats some crunchies as a little snack, some fresh water, and I am eating a popsicle before I go to bed. Here's Goldie. So Boo is at the animal hospital. He could be there for 2 days, 3 days, 4 days, 5 days. They don't know. They will be administering fluids to him to try to bring his kidney values down. Hopefully that'll work. And they're going to run some other tests to try to figure out, the cause of his kidney issues right now. The vet that I talked to there today was very, very nice, very knowledgeable. She has more than 20 years experience. And she said it could be a whole different variety of things. It could be a UTI, it could be kidney stones, it could be cancer, it could just be congenital, a genetic with him. It could be, kidney failure. It could, be a whole bunch of different things. So they are going to be running tests. She said he was behaving really, really well.
There's lots of different reasons why cats will have elevated kidney values. Right now, his kidneys are not working normally.
Yeah.
When you are dehydrated, your kidney values will go up, but your urine will be really, really concentrated because the body's trying to conserve water.
Yeah.
And he is not doing that.
Okay.
He's losing water through his urinary tract, and that's probably causing some dehydration.
Yeah.
And he's more thirsty to try and fix
it.
Yeah. So we can see this happen with chronic scarring in the kidney, so old age type changes.
Yeah.
We can see it with kidney stones where there's kind of an obstructive process.
Yeah.
We can see it with cancers. We can see it with infections up in the kidneys. We can see it with congenital problems, and sometimes they can be born with kidneys that are abnormal. I'm mentioning this is a weird one, but I'm mentioning it specifically because people have noted his kidneys were a little bit large and throughout his life. So it's possible for them to just be a little bit abnormal, but then you add in aging. And together, they weren't starting at 100%, and so they lose a little bit because of aging, and then the two things together mean that they develop kidney disease sooner rather than later.
Yeah.
So a lot of different things could be going on.
Yeah.
I would recommend that we admit him to the hospital. Our goal would be to try and flush out his kidneys and bring his kidney values down as low as possible. I would do a few more tests trying to determine underlying cause. If there's a kidney infection, sometimes we have reasonably good success and we can gain a lot of ground, with treatment. For the other types of causes, it's a little bit more hit or miss.
Yeah.
Stones, I should say. Stones sometimes we're successful with as well as we dislodge the stones. But aging changes and cancers and things like that are not going to be as good.
Yeah.
We can manage those things for some amount of time, but it's not something that we're going to really be able to cure.
Yeah.
So we would keep him until we thought that his kidney values were as low as they could be. So sometimes that could mean that we get them all the way back down to normal.
Yeah.
In other cases, we get them down, they're feeling better, they feel like eating, they're clinically doing better, but values are not normal.
Yeah.
And in those cases, then we often will continue with care at home by doing things like fluids under the skin.
Yeah.
That can be something challenging to do with some patients. The way he is here, he's such a sweetheart.
That's how he is with strangers.
Yeah.
I mean, because...
So I don't know if you'd be able to do it at home or not, but we could teach you how to do it and you could try.
Yeah.
If that were needed.
Yeah.
In most cases, it is needed, but not all.
Yeah.
Okay.
Well, I have like two of my neighbors do rescues.
Oh, okay.
We live right across the street from the woods. All
Yeah.
my cats are rescues.
Okay.
He was a rescue. He was a feral rescue.
So you have some support and
So
help if you need it.
They've off, like one of them especially. She's like, if you ever need help with fluids, let
Right.
me know, because
Perfect.
they do that.
Yep.
And like one of my other friends had to give her cat fluids.
Yeah.
But like I said, Boo took me 2 hours to get him in carrier today.
Wow.
Yeah,
All right.
he's strong and
So
feisty.
he's maybe not showing his true colors to us.
Oh no, he's a ladies' man.
Okay.
Especially with strangers.
Yeah.
So he's probably like so happy right now. Like I had family over for Easter and they were like, "There's nothing wrong with your cat."
Yeah.
Like he was like, I'm like, no, he's just not eating right. So yeah, I mean that's a bridge I would cross, and I'm sure I'd be able to manage that somehow.
So yeah, we'll cross that bridge when we come to it.
Yeah, I did have a question. Like, would a high protein diet cause kidney stones in a cat?
Diet can definitely impact kidney stones. There's lots.
But he would have pain if he had kidney stones, wouldn't he?
Some cats don't always show pain the same way we do. Some of them are much more resilient, and they can't verbalize it.
Yeah.
So not always.
And he's a tough guy.
Yeah.
So he's Mr. Strong.
Yeah.
I was just wondering because because my previous cat, the one that passed away in December, she had slightly elevated blood glucose.
Mm-hmm.
So like I was restricting carbs,
Yeah.
which tends to be like a more high protein, high fat
Right.
diet. So that's why I was wondering if that would affect his kidneys, because some people say
Yes, the high protein can definitely affect the kidneys. Kidneys have a little bit of trouble dealing with excessive amounts of protein.
Yeah.
So we're going to deal with what we need to now. I would not necessarily tell someone not to have their cat on a high protein diet if their kidney values had been normal at that point,
Yeah,
So,
I was just wondering because I'm like, what are the chances like two cats like with major issues after going on this switching to higher protein?
Yeah. Well, so the types of things we would be watching, we'd be watching the anemia.
Yeah.
There's a very significant chance that the anemia is truly a bit worse than it looks on blood work, just because even though he's drinking, he is a bit dehydrated.
Yeah.
And that means that the values sometimes can be more concentrated than they really are. So once we get them on fluids and rehydrate them, sometimes the red blood cell count value will drop. Doesn't necessarily mean they're truly more anemic, it just means that's what their real value was.
Yeah.
Anemia, as you already mentioned, it is really common with kidney disease, so that won't be surprising at all. He is not acting clinical for the anemia right now. It's I suspect that it's still going to be a mild anemia.
Yeah.
I don't suspect it's going to be severe at this point, but it is something we need to watch for the future.
Yeah.
We definitely want to watch the kidney values and the electrolytes. Kidney cats will often have low potassium. He does not right now, but that's something we're going to have to make sure that doesn't happen.
Yeah.
We'll want to check his blood pressure periodically and make sure that stays okay. High blood pressure is a really big issue for them. We would want to do an abdominal ultrasound to look to see if we see any evidence of what the underlying cause is. And we'd want to do a urine culture to try and see whether or not there's any evidence of infection. So those would be all the different things that we'd be looking for. So from here, if this seems like something you're interested in, which I assume since you're here, then I'll write you up an estimate and we can see, how the plan works, okay?
Yeah, that would be great.
All right.
And so do you have any idea, what would he be here for, 2 days, 3 days, 4 days?
I would say anywhere between probably 3 and 5.
3 and 5, okay.
Yeah. So it just depends. Every day, we would know more. The first 24 hours, quite frankly, usually you're not seeing much of a budge in the numbers. I'm always very discouraged if the numbers go up. That's going to be bad, obviously. If the numbers are getting worse, yes. It's most often in, really sudden cases where, there's lots of different reasons why it could happen.
Well,
but
if someone ate poison or something?
Sure, or just if something bad is going on right at that moment, and, we're just behind, we're trying to catch up to the process that's going on.
Yeah.
So if the numbers go up, that's going to be really bad. If the numbers stay the same for the first 24 hours, it doesn't really tell me that much yet. And then any amount that the numbers are improving, I'm going to be more optimistic. But you have to put that together with what the other tests are showing us. So
Yeah.
so we'll get more information every day that goes by.
So basically, he would just be here like on a fluid, like on.
He would be on fluids, some medications to help his stomach. So hopefully he'll start eating.
So you guys are gonna feed him?
Yes, we will feed him.
Feeding tube or just feeding?
I'm just offering him food to start.
Okay.
And I won't do it tonight because he's going to have the ideally, he's going to have the ultrasound in the morning. And so I want his stomach to be empty so they can see everything. Yeah. But then after that, they'll definitely offer him food. And usually, as you said, fed is best. So we're going to give him lots of options for things to eat. In the long run, we want him on the kidney diets. But in the short term, we just want him to get calories in.
Yeah. Did you guys weigh him when he came?
He was 13.36.
Okay.
So, okay. Just give me a few minutes and I'll write up that estimate.
Thank you.
You're welcome.
And the estimate for this trip to the animal hospital was somewhere between $6,000 and $12,000. So what I did the other day was, while I was waiting for the test results, I opened up a care credit. I think it's like the care credit card. And they gave me a credit limit of a little more than $10,000. So what I did today was I put the deposit on that. They put like $6,000 deposit on it. And with the care credit, it gives me 6 months to pay it off without interest, which would be great. So that's why I chose to use that. I'm hoping Boo does okay. They say that the first 24 hours of administering fluids are usually like the most crucial. Then they'll see if the numbers are going to go down, if the numbers are going to just stay stable for 24 hours or potentially even go up, which, could indicate complications. They said that he's going to be kept in a special feline-only unit because he seemed to be stable. But if he becomes unstable, then they'll move him to the critical care unit. The critical care unit is what I saw when I was there with Stella. So it's like a room with like cages all around it. She said there's cats on one side, dogs on the other side. So it's not as peaceful for them as the feline-only unit, but the cats need to be more stable to be in the feline-only unit. But just the fact that they have one is great. And he was doing really well with everyone. So I said, can I see him before I leave? And she said, sure, someone will bring him in. So the triage nurse brought him in, and he was wrapped up in a blanket, and he had a cone around his neck, like a cone around his head. And his eyes were all big because he was scared. But then when he saw me, he was just so happy. So she left him in the room with me. And as soon as the door shut, he didn't want to be in the blanket anymore. He didn't even want to be on the exam table. He was trying to get off. He was just trying to get out of there. I had to restrain him and hold him down on the table basically, because he was just I want to get out of here. I just don't want to be here. So I thought that was a good indication that he had a lot of strength and energy and he was acting normal. And Boo, he doesn't want to wear that thing around his head. But when he's with people like the women that work there, he was on his best behavior and he was, cooperating with them and following their instructions. So at least that's good. So I'm just hoping and, praying that everything works out and he responds to the treatments. And, I'm hoping it's just a quick and easy fix for him, or even if it's not, let's just hope that he becomes stable and he could come home again, because that would just, then we could work on, getting him onto a diet for what he needs and, try to extend his life as much as possible. Right, Sammy? We're going to be focusing on quality of life. Right, Sammy? So I'm glad I was able to get him there tonight. I'm hoping I'll be able to get some sleep. And, that's all we could do. They said that a doctor should be calling me sometime tomorrow after 9:30 a.m. And that usually the most critical patients get the first phone calls. And, the later that they call me, the better. It means, he's doing better. So we'll see. It does make me nervous because, when I left Stella there, I got the phone call at, 5 o'clock in the morning that she wasn't doing well. So hopefully Boo will, do really well overnight. And, yeah, so I'm just going to spend a little time with the cats and then go to bed and try to get some sleep. Another thing I should mention is that so far, I haven't been gripped with anxiety today over this. I've just been, in deal with it mode. I've kind of reverted back to what I was talking about the other day, where I just feel like this calmness has come over me, and I just feel like centered and balanced, and, I just have to do what I have to do, that kind of thing. I think it does help that I've been taking rescue remedies. I've also been eating the theanine candy. So while I was at the animal hospital, I was alternating between rescue remedy, theanine candies, and gingins, the ginger candies. And I think it really helps. Like the ginger candies I take so I don't get nauseous. I didn't get nauseous. I also brought potato chips with me, which I was snacking on, and water. And the L-theanine I take to help just like relax me. And then the rescue remedy is like anti-stress. So I think the combination of all three was super, super helpful. Here's Simba. He keeps running away from me. Like right now, Simba's afraid of me. He's under the day sofa in Boo's room, but every time I see him, he runs away. He's really hiding from me right now. I think he's afraid I'm going to take him somewhere, because I just took Boo somewhere. It's been a lot for the cats. Between Stella and then Sammy and then Simba went to the animal hospital last week, and, today Boo. So it's been a lot. But thankfully I didn't have to spend 6 hours at the animal hospital today. I was only there for 2 hours and 20 minutes. Right, Simba? You're okay, Simba. You're okay, all right? You're okay. It is 1:20 a.m. and I want to have a little talk with Simba before I go to bed, because I know Simba's upset about Boo, because Simba and Boo are buddies. Simba, Boo's okay. You know where you went last week? The animal hospital where you went last week? That's where Boo is, okay? And they're keeping him there because they're giving him medicine, okay? They're making him feel better because he hasn't been feeling good recently, Simba. So they're giving him some medicine, and they're going to do some tests, and they're going to see why he hasn't been feeling good, Simba, okay? So don't worry about Boo, okay? Don't worry about him. He's doing okay, and hopefully he should be back home in a few days, okay, Simba? So he's in very good hands. They're taking good care of him. Remember the nice doctors and nurses that saw you there? Yeah, you remember them. They were very nice to you, right, Simba? You like them a lot. And now they're taking care of Boo. They're going to take care of Boo. All right? So you relax. So something else that I wanted to mention, which I really think is helping me not have anxiety this time, is the fact that I sat in the sun today. I got a whole bunch of vitamin D. I sat in the sun yesterday. I got a whole bunch of vitamin D. So now that the weather's warmer and we're not in the middle of winter, I've been, getting sunshine and vitamin D, and I know for a fact that has completely been lowering my anxiety levels, if not eliminating them entirely. So I know that's been helpful, and I really think that that is one of the key differences, because in the middle of winter, when it's so dark out, the days are longer now. But in the middle of the winter, when the days are shorter and it's freezing cold and it's, 22 degrees out and there's, no sunshine and no warmth, no natural vitamin D levels, it makes a huge difference. Right, Simba? You feeling okay, right? You gonna sleep here tonight? Okay, you can sleep here or you can sleep on my bed, okay? Because I'm going to bed. Right, Simba? Okay, you'll be a good boy, Simba. It is 7:51 in here, Splash. I got some sleep last night, like I slept, but the quality of my sleep wasn't that good, according to my Garmin fitness watch. And I've been pretty much like under stress all night while I was sleeping. And I could feel it. Like I could feel the adrenaline and the cortisol in my body. Like my body is very tense. I'm not relaxed. So when I woke up today, I drank some water, and right now I'm sucking on one of those theanine candies. So I'm hoping that helps to relax me. And I'm going to start working on some of my vagus nerve exercises. They're just things that I do to reset that because that's what causes my anxiety. My body gets stuck in fight or flight, and it needs to get into rest and digest. That's why I can't eat food when I'm stressed out, because my body is not in rest and digest. It's stuck in fight or flight. Here's Simba. Good morning, Simba. The house feels so empty without Boo. Like so quiet and so empty. This is the food that was left over from yesterday. So I think there's some baby food on this plate. Someone must have ate that. And this is the canned food that Simba and Splash had for dinner. They didn't really like it. This was something I was trying to feed Boo. There were crunchies out here for Splash and Simba last night. That's what they ended up eating. So I'm going to clean this up. Another thing that I need to do this morning is just get myself moving. Because the more I could get myself moving and drinking water, the more I could try to process this like cortisol and adrenaline and just start feeling better. And another thing I can do this morning is go stand outside, not with a coat or anything. Just I'm going to go stand outside barefoot in my pajamas because cold therapy is really good at resetting the vagus nerve. And that's what I did weeks ago when I found out about this, except I would go out there in 30-degree weather and I would just stand out there for a few minutes and then I would come in. So today, right now, I think it's like 50-something degrees out there. And I'm like shivering right now, but I know that for me, that's like an anxiety response. I'm not shivering too bad, but like I could see the camera moving. The camera's moving like that. So that's what I have to do. I have to do like all these vagal nerve reset exercises today. I did some breathing when I woke up. Oh, and another thing I could do is put a cold compress on my head or behind my neck or on the side of my neck. That's another thing I could do. But right now, I'm going to get myself moving, see if I could burn off, this cortisol and adrenaline and see how I feel. It is 8:15 and I also did some yoga, just a few poses. The child's pose is very helpful for the vagus nerve reset. So I do it two ways. I do it with my arms and my hands extended out on the floor in front of me. And then I also do it with my arms and my hands extended like out on the floor behind me. And I do find it to be helpful. But what I'm realizing today, because it's so quiet in the house, is that Boo is my greeting committee. Like when I wake up in the morning and like I get out of bed, he's my greeting committee. Like he'll see me, then he gets up and he's happy and he stretches and he comes over to me and, he says hello. He's kind of similar to how Sammy is with the Lucky 7 downstairs. So like when I go downstairs, Sammy's my greeting committee. Like she's the one that always comes up to me first and she'll be like meowing and just really happy. And, that's the equivalent of Boo. And I'm not saying that like Simba and Splash never do that. I'm just saying that Boo does it like on a daily basis. Right, Simba? You're tired, you're upset. Simba's worried about Boo. You're okay, Simba. You're okay. Don't worry about yourself. Don't worry about Boo. Everything's going to be okay, Simba, okay? He misses Boo because Boo's his buddy. Boo's his buddy. Okay, Simba. There's Sammy and Goldie. Can you see them? I'm super zoomed in. They're still in bed. Here's Richard. He's still in bed. Here's Nancy. She's still in bed. Here's Ziggy. She was sleeping on the couch. She just got up. So who are we missing? We're missing Ringo and Eva. You're going to jump from there? That's a big jump, Ziggy. Big jump. Here she goes. Yeah, and that's why I have the wood on the wall. You heard her scratch her nails on the wood. So I am going to let everyone continue to relax. I'm not going to upset anyone this morning. I have to go upstairs, get ready for my day, and get moving. So this gives me a good opportunity. It is 9:20 a.m. and I am back to having to force myself to eat. So I'm going to start my day with 2 tangerines. Now I'm working on a hard-boiled egg. And after this, I'm going to have some instant oatmeal. I'm just following like the routine that I used previously when I was dealing with, Stella's passing and Sammy being missing, because I know that got me through that. So that's what I'm doing today. It is 11:41 a.m. and I am vacuuming the house right now. And I'm just trying to keep as busy and active as possible right now. I'm just trying to be productive, get a lot of stuff done this morning. So I already fed the cats, and then I scooped their litter boxes. I washed all the plates that were left over from Boo because I was feeding him such soupy food that I was not putting them on paper plates. I was putting it on regular plates. So I had a lot of dishes to wash. And now I am vacuuming the house, cleaning stuff up a little bit. And I was only able to eat half of a packet of instant oatmeal, but that's fine. At least it was something, along with the hard-boiled egg and the 2 tangerines. So that's what's going on. Here's Simba. He's not happy when I vacuum, so he's up here right now. So I did not hear back from the animal hospital with regards to Boo. I'm hoping that's a good thing, because one thing that the vet told me yesterday is that they call the most critical patients first and the more stable patients later. So, don't think it's strange if I get a phone call after 11 a.m. and now it's after 11 a.m. I do have an uneasy feeling in the pit of my stomach, like butterflies in my stomach. But I'm trying to manage this stress and anxiety the best that I can. And I just had a rescue remedy. And I just ordered a whole bunch of those theanine candies. Instead of having to go to the store and find them, which can take a long time, I just ordered a bunch online, a lot. So I'll have hopefully a several months supply of those should I need them, because they work so great. It is 1 p.m. Here's Sammy, Ringo, and Richard. They're hanging out here. And I just got a call from the animal hospital about Boo. They said he did good overnight, and he's been cooperating with everyone. And they did the ultrasound on him, and it appears that something is going on with his kidneys. He says it looks like there's disease in the kidneys. I mean, I don't remember exactly what he said, because I was kind of just, trying to take everything in at the same time. He also said there's thickening of his intestines, and his spleen looks mottled. So he doesn't know if this is cancer in Boo, or if it's IBD, or if his spleen is just working overtime trying to make red blood cells because Boo's slightly anemic, or if his kidneys are, looking like that because it's congenital or something. That's just how, he is. Sometimes cats do have abnormal kidneys. So what they need to do is a needle biopsy. They're going to do a needle biopsy on his kidneys and a needle biopsy on his spleen. They're going to do that this afternoon. And he says those test results usually don't get back for 3 to 5 days. So we won't know for that long. He's supposed to call me back later with Boo's kidney levels. I guess they're going to test his blood later and just let me know, because he's been on fluids, all day. They haven't fed him yet because they wanted to do the ultrasound first. And I scheduled an appointment to go see him tonight. They have visiting hours at night. They have visiting hours in the middle of the day, but with everything that's going on with Boo right now, I think it's a good idea. So I'm supposed to go there around 8 p.m. and visit Boo. And I hope he looks okay. After Stella spent 24 hours in the other emergency room, she looked absolutely horrible. She looked great when I brought her in there. And then after 24 hours, she just looked like she was on death's door. So I hope Boo looks okay. And I hope my visit with him goes well. And I've been so calm and good about this whole thing. And right now it's just hitting me. And I'm so sad because I don't want to lose Boo. Stella passed away less than 3 months ago. And now Boo has this super serious diagnosis. I'm just trying to be strong and calm and get through this. And I have to be strong for Boo and do the best that I can for him.
So we did great overnight. Our vitals were nice and normal. nothing out of the ordinary. We didn't feed overnight just because of the abdominal ultrasound. And then we did get the ultrasound done this morning. He was really good for everything, his morning exam, for the ultrasound as well. A couple things were noted to be found. So the two big things that were noted on his ultrasound was his kidneys. Obviously, as we know, they're a little more prominent than normal.
Yeah.
And the kidneys do look like they have some form of infiltrative disease to them.
Okay.
And what I mean by that is some form of cancerous process, unfortunately.
Okay.
The reason we're thinking of that is because his intestines and his spleen also look like they have some concerns to them. So the intestines are very, very mildly thickened, which usually in a cat, the two primary differentials or the two things that we usually think of causing this is one, with some cats, they can get inflammatory bowel disease. And that it's basically like an upset, intestines, and usually that resolves with a small course of steroids and some GI medications and diet as well. And then the other thing is GI lymphoma, which is a cancerous process of one of our white blood cells that usually infiltrates the small intestines. His intestines do look thickened, but the other abnormality that follows suit with this is that his spleen looks a little more prominent and mottled. It has like a mottled appearance. And usually with a mottled splenic appearance, the two things we think of are, again, one, cancer, so cancer that is spreading throughout that, or two, something we called extramedullary hematopoiesis that's happening in the spleen, which is the fancy medical term for the spleen is working harder than normal, and it's producing new red blood cells. The spleen also has a role in breaking down old red blood cells from time to time. So throughout time, that can also be what's happening. There's obviously no confirmed diagnosis as of now. This is all just based on what the internal medicine specialist has seen on the ultrasound and the trends with his history and things. The other thing is his FIV positive status. So his immune system already is, taking a hit because of that. And usually cats that are FIV positive are at a higher risk of getting, cancer in the future. So in regards to moving forward, recommendations, I know we also have our kidney azotemia, so our values are high. We are on fluids, we are on medications like GI supportive meds, send out a urine protein ratio to make sure that the protein in the urine is real. And then, we're monitoring his blood levels because we don't want him to get anemic. The kidneys are responsible for producing the hormone that tells the body to produce new red blood cells. So when they're affected or they're defaced, like the structure of them are abnormal, sometimes they don't make that. And that can secondarily cause them to, become anemic. Right now, we're not truly anemic. We're trending low, but with his FIV status and his kidney enlargement, this could be his normal. So plan moving forward, a couple things. One, the internal medicine specialist does recommend, if you are okay with it, taking a needle biopsy of his spleen, and then possibly of his kidney, just so that we can get an answer of one, is this cancer, or two, is there something else going on? There are obviously risks with a needle biopsy. The two big ones are bleeding and infection. So we do have blood work on hand to make, that shows us that he's okay for everything. The blood work done on the 17th at your regular vet, he does have normal platelets, which is great. So he should be okay from the bleeding aspect. And then the second risk is obviously we can introduce bacteria and infection. It is a sterile procedure, so we clip and clean the area, do everything very, very sterilely as best as we could, but there was always that risk. And if something does occur, then usually what we do is we just do a small course of antibiotics.
Yeah. Does he have to be sedated or put under?
Nope. Nope.
Okay.
So he was good for his ultrasound and things like that. Usually they stay pretty still for that. If we do need to sedate, it's not like a general anesthesia, so he won't be as if he's going into surgery or like getting like a CT or an MRI.
Yeah.
What I usually do is we give him an injection of a sedative med that basically is like him getting 2 Benadryls, and then he'll feel sleepy. There are obviously risks with the sedation, just like with any procedure. So with sedation, the 2 big ones are, one, adverse drug reaction. So, some patients, some humans are allergic to certain medications, others are not.
Yeah.
We obviously monitor him throughout the process, and we use a low dose of the drug. And then the second one is with any sedation or any drug use, there's obviously the risk of sudden death.
Yeah.
Very, very low on the list, but
Yeah.
Always a possibility and a risk.
Yeah.
Okay, we do try and obtain the biopsies without sedation first.
Okay.
If they truly don't sit still or are uncooperative, then that's when we reach for sedation, okay?
So that's something you would do today?
Yeah. So I'll tell the internist, we'll sign up the procedure. She'll get it done today. I usually get the biopsy results in 3 to 5 days. So probably, since the weekend is coming, probably by Monday morning I'll get those results. And then we'll go over, what the results are. If they are cancerous, concern for a cancerous process, then usually we recommend following up and speaking with an oncologist if we do want to work that up and, pursue with treatment. Rather than sometimes if it's not a cancerous process or it's something else going on, then we talk about treatment plan moving forward.
I mean, if it was not cancer, what else could it be?
So it could be, if for his intestines, like I mentioned, it could be like the inflammatory bowel disease. His kidneys, it could just be a congenital thing. So was he always born like this? Very possible, but was he born with abnormal looking kidneys? For the spleen as well, it could be that the spleen is, just overworking itself.
Yeah.
So
Okay.
it could have had like a previous injury, or it's just breaking down red blood cells more than normal and building new ones, things like that.
Yeah.
But the biopsy usually does tell us.
Okay.
There is a small chance it comes back inconclusive since the sample is a needle biopsy.
Yeah.
And if they do come back inconclusive, then usually we either say, one, we take another needle biopsy, or sometimes we'll just do a surgical biopsy, and we'll go in and take a small piece surgically.
Yeah. Okay. All right. So, I mean, we just have to take one thing at a time at this point. So.
Yeah. Yes.
And he's doing okay otherwise?
Yeah, he's doing fine. I have him on his fluids. As far as plan moving forward, I would like to keep him on his fluids just because
are his numbers going down at all or not yet?
So I am going to recheck his kidney values at 4 p.m. today.
Yeah.
They usually don't drop drastically within like the first 24 hours.
Yeah.
But at least so that we have a baseline of where he is. A lot of times too, especially in cats that get chronic kidney disease pretty often.
Yeah.
Sometimes their values don't ever go back to normal, quote unquote.
Yeah.
They just go back to their new normal. So, he may plateau his values at a certain level, but he's clinically doing well. He's eating, he's walking around, doesn't seem
he's
in
eating?
pain.
He's eating?
No. I'm saying in the future, if his values stabilize and he's eating and we're not worried, then we can say,
you got me excited there. I was excited.
No. So he hasn't been offered food just because of the abdominal ultrasound. So now I'm going to sign him up for food. I am going to give him an appetite stimulant just so that he gets a little bit of a incentive to try and eat.
Yeah.
And then we'll proceed with there. I'll give you a call before I head out today just to let you know how his blood work is looking, how he's doing throughout the day, if he did eat, and then plan moving forward, okay?
Yeah, do you guys have visiting hours or anything over there? How does that work?
Yeah, so visiting hours are between 12:30 and I think 2 p.m. Probably wouldn't recommend it right now just because he'll probably get his procedure done.
Yeah, I don't want to get him excited. Yesterday he was too excited.
Yeah, and then we have late visiting hours, so you can do between 7 and 9 p.m.
So that would that be a possibility or no?
Yeah, it'll be a no doctor because I won't be here. So what they'll do is one of the nurses will just pop him into a room with you. You can spend time. Usually, I think it's between 20 and 30 minutes. You can hang out, and then once you're ready, you just let them know, and then they'll bring him back, and then start up his treatment.
Okay, again. So do I have to schedule an appointment for that, or do I just come there?
No, you can let me know, and then I'll let the front desk know that what time you're gonna come. Do you think you're gonna come like 7:30?
Maybe like 8 p.m.
Okay, so I'll let the front desk know just so that we can reserve a room for you.
Yeah, that'd be great.
And then if you're a little early or a little late, just let the front desk know. And then again, once you're done visiting, they'll bring them back. Okay.
Okay, thank you so much.
It's 3:40 p.m. Here's Sammy, Ziggy, and Nancy. Richard is on the floor. And I just got a call from the animal hospital where Boo is. So what happened was I had to run to the post office. And while I was out, I was like, you know what? I'm just going to get a hamburger from a burger place around here. They're better than like typical fast food burgers. So I got one of those because I just needed something to eat that was going to be somewhat substantial, that I could, tolerate. It's going to be easy to digest. So that's what I got. And I came home and I ate it, and I was looking up stuff online, with regards to a potential diagnosis for Boo. And then I was like, you know what? I'm going to go sit in the sun for like 20 minutes, which I did. And it relaxed me so much, but it's really hot out today. Like sitting in the sun, even though the UV index wasn't very high, it's really warm out today. So I was like, it's just too hot out here. So I came inside and I laid down on the couch and I set a 20-minute timer. I'm like, I'm just going to take a nap for 20 minutes. And I must have dozed off because all of a sudden I hear my phone ringing and I'm like, what the heck? And I look at it and it has the name of the animal hospital on it. And I'm like, oh no, like my heart sank. I just had like a little heart attack because I was like, what happened, So I pick up the phone and it was their billing department, and they wanted to let me know that they're going to give me a daily update with regards to like the balance of the bill. And she says, they're going to call and let me know, and every other day they're going to email me. So I was like, okay. And so today so far is at like $3,100. Because, I guess they did the ultrasound, and maybe that includes the needle biopsies and the fluids and everything. So just taking it one day at a time. But I do like the fact that they do offer like a daily update with the total and the balance. So it gives you, you could figure out and plan, what you need to do and, stuff like that. I made sure that not only do I have the balance of my care credit available to use, that I have a balance on another credit card if it goes over the limit on the care credit. So that's the situation. I need to drink water because I'm dehydrated. So I just wanted to digest my lunch a little bit. And then I'm going to start drinking more water and trying to decide if I'm going to bring anything for Boo when I see him. Like, I don't know if they're going to let me bring anything for him. Like, I'm going to maybe bring his little favorite feather toy or maybe some treats, but I don't know if they're going to let me play with him or give him the treats. This is a much more professional hospital than the emergency room that Stella was in. So this is a book that I've had for about 25 years. And I know when I purchased it because inside it has this sticker and it says 72500. And I read this many, many years ago, and I remember it being an excellent book, and, totally changing the way I thought about so many things. And so the other day, I found it again, like the day that Simba went to the animal hospital. I looked for this and I'm like, it's a small book. I'll just throw it in my bag. I'll have something to read in the waiting room. Unfortunately, I forgot to throw it in my bag. But I started reading it the other day while I was like waiting for Boo's test results to come in. And I forgot what an amazing book this is. This is just such a great book as far as encouraging proper thoughts. That's the best way that I could describe it. This is bringing me back to who I used to be. Before all the drama with Stella, before all of the stuff that has been going on over the past several years, just in general, not specifically with me or the cats, but with life in general. I had gotten myself stuck in some negative thought patterns, which I didn't like and which were not helpful to me. And reading this book, like I'm not even all the way through it yet. I'm almost all the way through it. It's a very short book. How many pages is it? It's only 72 pages, so I'm almost done with it. I'm like on page 65. And I'm definitely going to read this again. And this author, James Allen, wrote several other books, so I'm going to look for those also. I just feel like this is getting my head back where it needs to be and where it was for many, many years. It's giving me back something that I have lost recently with regards to clarity of thought and focus of thought, positivity over negativity, and stuff like that. So I just wanted to point this out because I think this book has just been so helpful to me over the past week, and I'm hoping it continues to be as helpful to me as I move forward with this situation with Boo. I don't want to give up on Boo, and I want to stay positive. And I want to appreciate every minute and every day that I have with him and hope that there are many, many more days ahead with Boo. And obviously, this can be a very difficult time, especially depending on what the final diagnosis is. But this so far has just been so super helpful. Basically, what I'm feeling as I'm reading this book and what I'm remembering and what it's doing is it's bringing me back to peace of mind. Look at Ringo. The house is so quiet without Boo. I mean, it's quiet without Stella, but, you know, we've adjusted to that pretty well. And now it's quiet without Boo.
have to replace his IV catheter because the catheter was coming out a little bit.
Yeah.
So the nurses just replaced it. He was perfectly fine for that. We did get the aspirations of his spleen and the kidney.
Mm-hmm.
And I sent those out. So hopefully, as soon as those get back, I'll give you the update talk of what the findings were.
And once again, you said that would take how long?
Usually anywhere between 3 to 5 business days.
Okay.
So I'm hoping by either this weekend, maybe Friday. Sometimes they're a little early.
Yeah.
But if I don't get it by Friday, usually then it comes on Monday because of the weekend.
Okay.
But they're usually pretty good. But once I get that in, either if I'm not in the hospital, I'll have another doctor keeping an eye out for it so that we get it right away.
Mm-hmm.
Otherwise, plan is, again, we're going to stay overnight, try to get those kidney values nice and stable.
Mm-hmm.
We're monitoring, our pain levels, comfort levels, hydration, making sure we're not giving too many fluids.
Yeah, and is he doing okay with all that?
Yeah. Otherwise, his energy levels are nice and good. We did the aspirations, I want to say maybe 40 minutes ago.
Okay.
And he was nice and active.
So does he get like a painkiller with that? How does that work? Topical pain relief or something? Nothing?
So he is on a combined pain / anxiety med, but the needle that we use is so tiny they usually don't react to it.
Oh, okay.
So he did well for it. He didn't even really move or do anything much.
Okay.
But the medication I have him on is one we use for cats in hospitals with anxiety.
Is that gabapentin?
Yeah.
Okay.
So he's on a lower dose just because of his kidney issues.
Yeah.
And he's been handling it fine. I did update and round the overnight critical care team that's here.
Yeah.
Just on his case, so they're keeping an eye on him. Otherwise, he's doing fine. Okay.
Okay. Great.
I am not in tomorrow taking over the case. If it's not her, it'll be another medicine member that's on the medicine service. So they'll give you a call early around, I usually say like 11 a.m. because in the morning there's I don't know how many patients she'll have.
Yeah.
And then they round their medicine. Every service usually rounds between like 10 and 11.
Okay.
If they finish soon, but she'll give you a call, review how everything's doing. The next 2 days she'll be here, so she'll probably keep an eye out as well for the FNA results that they get back. But again, if it's not her, it'll probably be someone else from the medicine team. Okay.
Okay. Yeah, I just appreciate the information.
Yeah.
Kind of nerve-wracking on this end.
I know. But I already I let the front desk know that we're likely going to visit at 8, so you have your room and everything set up. They'll bring them up. You guys can spend time. Since it is a no doctor, there won't be a doctor that'll pop in since it's a later visit.
I did have a question for you. So, like, when I come to see him, can I bring him a toy, or should he not be playing?
No. Yeah, you can bring a toy. Sometimes I even encourage, since we want him to eat and do his things, if you have like treats that he likes at home or something.
Yeah, I was gonna bring him some of like the liquid treats that he likes, like the squeeze ups and stuff.
Yeah, you can bring that, and then if he does eat it and you want to leave some of that with us, I tell you the owners to let the nurse that brings him in or the assistant that brings him in,
mm-hmm.
So that they can put it on his cage, so that we know it's for him. Okay?
And then what about like actual food?
If you want to bring that as well, we have tons of food here, so he'll be getting offered a variety.
Okay.
But if he's like a picky cat at home and he wants his food, then feel free to bring that.
Yeah,
the only thing I think we can't take in is raw food.
Yeah, no, I wouldn't bring that in. But like recently, I bought some low phosphorus food for him, and he enjoyed it. And then like for like 2 days, and then when he really got super picky, stopped eating, not so much. So I'm thinking maybe if he's feeling a little bit better, he might want to eat it. I don't know. Yeah,
you could definitely try it. Sometimes they're picky for us in hospital, like the first day or two, and then we usually have owners come in and they're saying, "Oh, they ate with us on a visit." So
did he eat anything today?
Not much. No, he grazed a little bit of wet food earlier, but he hasn't had a full meal.
Yeah, like he just licks it, right?
Yeah.
Yeah, that's what he's been doing. Okay.
Okay.
Yeah, I get that.
So overnight, they usually try not to call owners just because there's limited on doctors
and
staff. So if you don't hear for us, I usually say no call is a good call. But if you do get a call, it's not the end of the world. Sometimes they're just giving you a generic update if something has changed, or if they want to recommend doing a diagnostic of some sort. Okay.
Yeah. Okay. Great. Thank you so much.
No problem. I appreciate it. Do you have any other questions I can answer?
No, that was it really. Thank you.
All right. So enjoy your visit, and then again, keep an eye out on your phone in the morning for the doctor that's going to give you a call, okay?
Okay, great. Thank you so much.
It is 7:40 p.m. and I'm on my way to see Boo in the hospital. I hope he's doing okay. And I hope he looks okay, and I hope I could get him to eat something. I brought all kinds of treats for him and food that he, was eating a few days ago. I brought 2 toys that he enjoys. I brought him a paper bag to lay on. I brought him like a quilt from the day sofa in his room if he wants to lay on it for a little while. I don't think they're gonna let him keep this stuff. I think it's just, for the 20 or 30 minutes that we have when I'm visiting him. I was just trying to think of everything that I could bring him. I have some wet food, some dry food, and I just want to see how he's doing, see if he's okay, and how he looks. They did tell me that they gave him a small dose of gabapentin for anxiety and for pain. Not that he's necessarily in any pain, but they were doing the needle biopsies, and they just wanted to relax him a little bit for that. So I should be there in another 10 or 15 minutes. Hey, Boo! Boo, it's me! Boo, it's me! He wants to get out of here. He doesn't even care that I'm here. Boo! Boo! Come here, Boo! Here, look, Boo! Come here, Boo! Boo, I bought your thing. Come here, Boo! Come here, Boo! Boo, you look so good, Boo! Boo, you look so good, baby Boo! I got you treats, I got you food. You can't go home yet, Boo, though. Boo, you can't go home yet, okay? We can't go home yet, but look what I got you, Boo. Look. 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 Sit on here. Sit on here. Sit on here. Okay, don't jump anywhere. Boo, look. Boo. Boo, I got your toy. Boo. No, you're not jumping. Get down. Boo. Boo. Boo, look. Boo, look. Boo, look. Boo. Boo, look. Look, I got your toy. He doesn't care. You don't care about your toy? Come on, Boo, look. You just want to escape? Don't you want your toy? Get down. Get down. Get down, get down. Here, look. Boo, I got your toy. Lay on your bag. Lay on your bag, Boo. Lay on your bag, okay, buddy? Lay on your bag. Yeah, you're a good boy. You want to eat some food? I got food for you, too. I got food for you, Boo. No, you can't go out. Boo, you can't go out. Come on. Boo, don't jump. Get down. Get down. Don't jump. No jumping. Come here. Come here. Come here, Boo. I got you good stuff. Look at all this food I got you, Boo. Boo, I got your favorite food. No jumping. Come on, here. Don't you want to visit me? I came to visit you. I came to visit you, and you don't want to visit me? Come on. Over here, Boo. Come here. All he wants to do is walk around the room. And he wants to get out of it. Boo, come here. Boo, Boo, get down. Get down. Come here. Come here and get down. Come over here. Get down. Here. Here. Okay, is he going to eat some of their crunchies? Is he going to eat them? Okay, you eat them. He's eating food. He's eating food. Good boy. Good boy. You don't want this? This is your favorite. Eat that. You don't want it? Come here, Boo. Come here, Boo. Boo, come here. Get down. Come here, get down. Come here. What's the matter? You don't like me? What you doing? What you doing? Come on. Come here, Boo. Here, look. Don't you want to play? Don't you want to play with your toy? You don't want to play with your toy, Boo? What are you doing up there? You okay? Get down. Get down. Boo. Boo's eating some beef baby food. He's really hungry, but he's too, nervous with everything that's going on around here. So hopefully he'll eat that and then I'll give him more. He's been licking some of the wet food. But all he wants to do is walk around the room. Boo's trying to crawl in the bag. He's trying to crawl in the bag so I could take him home. He's been jumping all around the room. He's also been eating a little bit of food, so that's good. But he hears all these sounds. He's afraid of the sounds. It is 8 a.m. Here's Simba. Good morning, Simba. How are you today? You doing, Simba? You okay? You still sleepy? Okay. I got a pretty good night's sleep. I went to bed on time. I was in bed by 11, I think. And I slept great until about 3 a.m. Then I woke up for a little while. Then I went back to sleep. And I feel like I had a great night's sleep. My fitness watch says it wasn't so great because I wasn't really in deep sleep or REM most of the time. But I'll take whatever I could get. Right, Simba? And here's Splashy. Give me a pet, Splashy. And last night I set these little automatic feeders for Splash and Simba with just a little bit of dry food in there. They went off around, 2 o'clock in the morning, 4 o'clock in the morning, just to give them something to nibble on so that they don't vomit, because Simba has that problem that if he goes too long without food, he vomits like some clear liquid. So hopefully that'll work. I was very happy to see Boo yesterday, and I'm glad our visit went well, and I'm hoping today goes well also. I don't want to get myself happy or excited over the fact that Boo was really energetic and, was in good spirits, and he seemed, good. Because, when Stella was in the emergency room, they told me, oh, she's doing well, everything's fine. And then the next day wasn't that good. So I'm hoping for the best for Boo. I'm hoping, he cooperates with everyone. He does well. The IV fluids that they give him, help bring his numbers down. And that he can come home, sooner rather than later. And I'm hoping his test results come back okay. And then we'll just figure out the course of treatment. Right, Simba? So this morning, around 5 a.m., someone up here was howling. I think it was Splash. I'm pretty sure it was Splash. Here's Splash now. And I felt so bad for him. I felt like he was howling because he's looking for Boo or Stella or he missed them. Because the way he was howling is how Ringo howls when Ringo's looking for other members of the Lucky Seven. Or sometimes Ringo howls like that by the back door. I don't know who he's looking for, but I felt bad for Splash. But Splash will be okay. He has Simba. The two of them are buddies. The cherry tree in front of my house has started to bloom. So at least that's nice.
I'm the doctor caring for Boo in hospital today.
Okay.
I just wanted to update you and go over a plan for today if you have time.
Yes, that'd be great.
Okay, so I saw Boo ate a little with you last night when you visited. That's great. He did not have any other interest in food overnight, though, since then. No vomiting, urinating normally, no defecations. He was a little nervous in hospital last night.
Yeah.
Was starting to kind of try to bolt out of his cage, things like that. So we did start anti-anxiety medication last night, and he does calmer with that this morning.
Yeah, when I visited with him in the room, he was very nervous, he was trying to escape. Yeah. And when he saw me, he didn't want me to leave. So so I feel bad, but should I visit him again today in the afternoon to try to get him to eat lunch?
Yeah, I think that's a good idea. If you're free this afternoon, I think that'd be good, especially because he's eating with you and he doesn't seem to be eating otherwise, I'm sure he's more comfortable with you.
Yeah, that's so. I was like, should I come by twice today and then again at 8 p.m. to try to get him to eat later?
Yeah, if you'd like to and you're available, I think that's great.
Yeah, I'm available. I just, I don't want to disturb anything that's going on with him today, but how's he doing otherwise?
Yeah, so his kidney values this morning are still pretty elevated, unfortunately.
Yeah.
They're about the same as yesterday. They did not improve. They're a little bit worse than yesterday, but about the same.
Okay.
We have the sampling that was sent out yesterday on the kidney and the spleen. We're still waiting for the results on that. Like we discussed yesterday, there is some concern that there is a cancerous process causing what we saw on the ultrasound. So we're going to keep an eye out for that, and we'll talk about results once they come back to us.
Yeah.
One thing that did happen this morning that's newer for Boo is it does look like his face is swollen on morning exam. So more so than typical for him. I know he's kind of a bigger cat with some chunky cheeks, but it does seem like he has some edema at this point, especially under his chin. So I have some concern that there could be fluid going outside of his veins and into his tissues.
Okay.
When I think about reasons for this, one thing that's very possible with him is he has low protein in his blood because he's losing it either through his intestines that looked abnormal or he's losing protein through his kidneys. We saw there was protein loss in his kidneys. So I'm checking the blood level of that protein today to see if it is low, and maybe that's contributing to it. Aside from that, other things that would cause it are inflammation of the vessels, causing fluid to be lost through them, or a clot that went up towards his head and caused this to collect. I think at this point, we'll start with the blood work and we'll see what that shows, and then we can kind of go from there. Another test we could consider this afternoon, depending on what you'd like to do and what that blood work shows, is an echocardiogram, just to assess his heart and make sure there's no kind of clots in his heart or anything that could be causing anything like this. On exam, his heart, it sounds normal. I don't hear a murmur. I don't hear an arrhythmia, but cats can be sneaky, and sometimes they have heart disease without really showing it. So I think that's something to keep in mind. And up to you as well. If you feel that you'd like to do that now, we can get him signed up for that today. If you feel like we want to start with the blood work and go from there, we can always do that.
I mean, what do you think is best?
I think if you feel comfortable with it, I'd like to see what the blood work shows.
Okay.
And then if we have a really obvious answer there, like if the blood protein's very low, that's very likely the cause. If it's not very low, then I think we should consider having the cardiologist look at him.
Okay. And is there a way, if it is low, is there a way to correct that?
Yeah. So we probably would have to do supplementation.
Okay.
And we can, if we find that that's something he's dealing with, we'll discuss it further.
Yeah, I'm concerned he's not getting enough food, because the day I brought him in, he really didn't eat more than a few licks. And then, he didn't eat at all yesterday, because I know they didn't want to feed him before, the ultrasound and stuff, and then the biopsies. So, he ate a little bit when I was with him, but, I wasn't there that long to get him to eat more. So that's why, I'd like to come as much as I can today to try to get him to eat again.
Definitely. I agree. I also have the same concern that he's probably not eating what he should be.
Yeah.
And I think it's great if you can come and encourage him to eat since he's more comfortable with you.
Yeah, so what can I schedule?
So what is your availability this afternoon?
I could come as soon as you got, as I can. I work from home and my schedule is very flexible.
Okay. Do you think you could come sometime between now and 1:30 is generally when we have visiting hours?
Yeah, I mean, I could probably be there between 1:15, 1:30.
Okay, perfect. Why don't you plan for that? And then I'm here so we can talk a little more in person, too, about kind of what's ongoing for him. Okay?
We did sampling of the spleen and sampling of the kidney, and neither of them said, yes, this is definitely cancer.
Do you need to do another one?
So at this point, with what we're seeing and all his signs overall, we're trying to put together, is there one thing that's causing all these issues?
Yeah.
He came in not feeling great, not eating great, and then we did these tests and we found he has an odd looking spleen. His kidneys are both very large, and then his intestines look very thickened. When I look through his historical blood work, though, he's had markers previously of what looks like he may have had thickened intestines in the past, and maybe we just haven't caught it yet. So I can't say for sure that his intestines are related to what's going on now. I think it could be, but it could be just something separate, that he has chronic intestinal disease, which in cats is most likely either inflammatory bowel disease, so he has inflammation of the intestines that can be diet, steroid responsive, or he has small cell lymphoma of his intestines.
Okay.
The only way to differentiate between those two themselves is with a biopsy of the intestines. So if we wanted to do that,
but you would have that couldn't be a needle biopsy.
That would be a anesthetic procedure. We would do a scope, so like a small camera, kind of like, how people get colonoscopies, but we would go through his mouth with the small camera and we would take tissue samples.
So he would have to be put out for that.
That would be anesthesia, yes. Again, I can't say for sure at this point, is that related to what's going on now, or is that something we're seeing that he's always had? And we're just seeing today, and it's just been some time he's had it, so it looks very inflamed. The other things that are going on, he's so sweet. The other things that are going on, the spleen and the very big kidneys. The spleen, the way it looks, we didn't see any obvious organisms or anything on the testing. But usually when there's kind of inflammation in multiple places, the thing I get most concerned for is there an infection that's in his spleen too, or is there a cancer? So those still are just our big two things, and we haven't found which is the cause at this point. Kidneys,
did the urine culture come back?
The urine culture did come back negative.
Okay.
So that's the other thing. The kidneys, which are very large, because they're both very big, my biggest concern is he had some kind of acute injury to his kidneys. Whether it is an infiltrative disease, infection, or cancer, or did he get into a toxin? Did he have anything that he ate that could have affected his
I can't imagine.
Okay.
Because he's not that kind of cat to eat stuff.
No, like lilies in your house?
None.
Anything like
Back in August, he had blood tests and all the kidney values were fine. He had 4 teeth removed in September.
Right.
And everything was fine then. And then he was fine the rest of the year. So I don't know. It's strange.
Yeah, and I agree. And from the testing that we're doing, it seems to be some kind of, he's trying to climb.
Yeah, yesterday, that's why I was trying to put this up there to block it.
Yeah.
Because he wants to jump out. He wants to go home.
Yeah.
I don't blame him.
Yeah. It seems to be some kind of sudden cause that's affected his kidneys, because he's otherwise, he looks good. He doesn't look very skinny, unhealthy, and now he has these very elevated kidney values. And then unfortunately, it was very possible that he had a kidney infection, and that could improve with some antibiotics. We did start the antibiotic just in case, but it doesn't seem that he has a kidney infection with what we're seeing on the testing.
Okay.
So at this point, I think our options are, we continue to support him, and we see how he does. With fluids, I'm having the testing run now to look at his blood proteins. Is that low? Is that why he has swelling on his neck?
Yeah.
Or is it related to a clot or something? Inflammation of his vessels.
Yeah.
The other thing I just want to put on the table and offer to you, and it's very owner dependent on what you're looking to invest in. Gold standard at this point for what he's experiencing, acute kidney injury, would be dialysis. That's not something we offer here. That is something that if you're interested, we could work on consulting and transferring him to another facility for that, where they filter the
And who does that?
and get toxins out. If that's something you're interested in, what that looks like is he stays in hospital. He usually has dialysis every day for a few days until his kidney values improve. And then he additionally is just on fluids in the meantime. The other thing that could be considered if we're looking to do everything is with the dialysis doing a biopsy of his kidney, because they're so big and we're not sure exactly what's going on there. You know, we sent out a cell sample, just put a needle into the kidney, but without a tissue sample, we don't always get a great sample. So a lot of the time that would give us the most information. If that's something you're interested in as well, it's not something we do here, but usually facilities that do dialysis would be able to facilitate that.
And for that, that's like an operation. He has to be put out, right?
That would be general anesthesia. Yeah, depending on the facility, I believe there are some, probably AMC, if you went up to Cornell in Ithaca, or if you went down to Penn in Philadelphia, they may be able to do it laparoscopically. But generally it's like a surgical biopsy. So there's an incision into his abdomen, we take a biopsy and close it back up, and send out that tissue sample. Those are all things that are options. It's, you know, I just want to make sure that they're talked about with you.
No, I appreciate that. Do you think he's at the point where he needs dialysis immediately, or do you think a few more days of maybe trying fluids here could work?
I think we can continue to try. My concern is we've already done, you know, at least a day and a half, almost a couple day of fluids, and we're not seeing improvement. We're actually seeing the kidney values go up a bit. So I think if we could definitely continue and see how it goes and make a decision, but I think if we're considering dialysis, today would be a good time to consider it. Because we're really not seeing too much improvement so far.
Okay, even though, like, I mean, when I brought him in, I was told that, like, you know, the first 24 hours, you're probably not going to see improvement.
Yeah, I think my concern at this point is that not only are we not seeing improvement, and now we're past that 24-hour mark, but they're actually increasing. And it's possible they'll continue to increase at this point if he's not responded to fluids as of yet. And just dialysis in general, doing it sooner than later is usually best.
And what's involved with dialysis?
Yeah, so dialysis, like I was saying, generally it's something that's performed every day for a few days until they check his kidney values and find they're improved. They're not doing them further. They put a dialysis catheter in, so they put a catheter into his neck that he keeps in hospital during that time, and they hook the tubing up to that each day to filter out his blood. The big drawback to dialysis and why it's not an option for a lot of people is the cost.
Yeah, what is the cost?
It's very expensive. I can get a estimate if it's something you're considering, but I would say that treatment itself, at least $5,000 up to $10,000 just for dialysis alone.
Okay.
So I just want to put that out there, just in case it's something you want to think about.
Yeah, I mean, it's definitely something I want to think about. The question is, after he goes through the dialysis, and then, like, what's the prognosis after that?
So, acute kidney injury in general, where there's something that happened suddenly that injured his kidneys, and it's not that he has this degeneration over time, which we're not seeing. We think it was more sudden, right? 30% of cats will not recover from it, unfortunately. They'll continue to worsen even with everything we do. 30% of cats will have some recovery, but will have some injury to their kidneys for the rest of their life. So they'll have some elevated kidney values that will need to be supported for the rest of their lifetime. And then 30% can recover and have the kidney values go back to normal.
Okay. Yeah, I mean, I definitely want to consider that.
Yeah.
I'm not a fan of, like, going into the city for it, though. I mean, so I don't know if there's you know, good options in New Jersey or...
Yeah, so Red Bank is...
I don't even know where that is.
Down by the shore, kind of by Asbury Park.
But where the fires are?
Oh, are there fires right now? I didn't even know.
Oh, there's a ton of wildfires, yes.
Oh, God.
In, like, thousands of acres in Ocean County.
Oh, really?
Yeah.
That's a hospital that does it. University of Pennsylvania in Philadelphia, the veterinary school.
Yeah, that's crazy far too.
Yeah. Yeah, so just something to think about. I think if we're, leaning away from that too, and we're looking to see what else can we do, we can continue the fluids. We can see how he responds to them. We'll evaluate the protein today, see if we can figure out what's causing this swelling around his neck. And then other things that we can consider, I'm going to call the lab and see if the sample that we sent of the kidney and the spleen, you know, when we send it, the test that we do is they look at those cells and they say, do they look like cancer cells?
Yeah.
I can see if we have a good enough sample with them that we can add on another test that is kind of more of a is this cancer or not? And it doesn't usually give us what cancer it is, but it can say, yes, these are cancerous. So that could give us a little more information of, are we dealing with cancer of the kidneys and the spleen? And that's kind of what's caused this injury. The other thing we can consider doing is sending out a blood test on him to look for an infectious disease called FIP, feline infectious peritonitis.
What is that?
Feline infectious peritonitis is a virus that cats get. It's a virus, it's a coronavirus, not the same as COVID, but it is a similar family of viruses. It's a virus that generally lives in cats for their lifetime. Most cats have it, not all cats, but most do. And over time, sometimes it can mutate and it can cause a systemic disease. And it can affect the kidneys and it can affect the intestines and all these signs. Which, you know, at this point we're concerned, is there something going on systemically? So it's definitely on our list. The test that's really the best for that is a lot of the time cats that get that disease have fluid buildup around their organs, in their belly. He doesn't really have any fluid. So that's good, but also I don't have any fluid that I can remove, that I can test. And so I can't run the best test. So one thing we could do instead is, he's so funny, checking a blood test. So the blood test, like I was saying, a lot of cats have this virus. Whether it mutates or not decides if it causes disease in them. Running the blood test can tell us, does he even have it in his body? If he has it, it supports that it's possible he's developed this mutated disease from it. It can't be definitive, but it helps support that. If it's negative, if it says he has no coronavirus in his body, then we know, oh, then if he doesn't even have the virus, then it can't cause this mutated disease.
Okay.
Okay.
I was going to blend him up some more food now because he almost, he ate all that. I was just going to plug this in. That's a lot. I mean, it's a lot.
I know.
Like, I don't want to give up on him because he has a lot of life left in him. You know, it's not like my other cat was. She was just out of it, like lethargic, completely out of it and everything. And, you know, I'm willing to do what it takes to try to get him through this without causing him, like, to try to minimize, like, his stress level and everything.
Yeah, I agree with that.
So I feel like anything you guys can do here to kind of pinpoint it would be great before, you know, if he was to go through dialysis. You know, I'd rather...
I do think if we're trying to keep that in mind, like his comfort and what stress level he would experience, I do think, even if ideally, you know, in an ideal world, if this was a human, we could tell them this is the best thing for you to get dialysis and to get a kidney biopsy. That would be great. But he is a cat and he doesn't understand. And so there is, I think, going to be a higher stress level with him transferring to another hospital, possibly going through this procedure each day, possibly having a biopsy of his kidneys. So while that may be good, I think from what you're saying, I agree it may not be the best option for him. So then if we
I don't want to rush him into that if I don't have to rush him into that.
Yeah, and I think we can kind of put it to the side for now.
Like, I'm going to definitely think about it and look into it. You know, please give me information as, like, definitely. You know, who does that. And that'll give me, like, you know, 24, 48 hours to, like, look through that.
We'll give it some time. We'll kind of put it to the side, but think about it for now. And then what can we do today? So we'll continue the fluids, continue the antibiotics. I am going to call the lab and see if we can add on that test to see if yes or no there's cancer cells in this. I think that's something, you know, we already took that sample, so we wouldn't have to do another sample or anything. And then we've already taken blood today. I'm going to look at that. And I'll see. I think if you're open to it, it would be good to send out that blood test and just see does he have that coronavirus as well.
Whatever you guys fed him last night, I don't know if it was written down. Whatever dry food or pate, he enjoyed it.
He liked it.
Yeah, so I don't know if
let
you
me
still
go
have
check.
it.
We should have it written down
Because he was definitely eating that dry food. He doesn't want the temptations. He doesn't want the origin. These are some Friskies. He likes his food pureed like this, which is why I did it. If he eats this, then that's the equivalent. Like 2 of these pouches, they're 62 calories each. So that's like almost like a full meal if he eats 2 of these.
Yeah, no, that's
Do you want me to leave you some of these pouches?
Sure.
I don't know how many extras I have.
We can.
I mean, I'll be back later anyway. I'll just...
Yeah.
At least he ate something.
Yeah, I think this is great. He definitely, I mean, obviously he seems so much more comfortable with you. I think if you're able to do this each day while he's
I mean, I could be here all day, but I don't want to, like, cause problem with you guys. I could just bring my laptop and work here, that's not a problem.
Yeah, I mean, I think, like, if you want to come once a day or if you even want to come twice a day, as long as we limit it to, like, an hour total per day, just because time he's here, he obviously doesn't receive the fluids.
Oh, okay. Yeah, okay, then I'll just I'll do like a half hour in the middle of the day. I'll do a half hour later in the day.
Perfect.
That way he'll see me.
So he'll eat, and I think that's great because I know that you were very concerned about him eating too, which I agree.
Yeah, because one of the issues I had with the last cat that passed is hepatic lipidosis. Yeah, and so that's always in my mind.
Yeah, and I think if we can keep him eating this way, the other thing I considered talking to you about today that I think if he's eating like this, we don't need to do right now.
You mean like a feeding tube?
Is placing a feeding tube would be something.
Yeah, I was gonna, if he wasn't gonna eat anything, I was gonna see about maybe trying to force feed him something with the syringe, but, because I know the last cat that I had, she was on a feeding tube, she didn't like it at all.
Okay, yeah.
Here, Bo.
Okay. I am gonna go see if we can get more of that kibble for you, the dry food.
Yeah, I don't know what it was, but he was very interested in that.
Good.
So maybe we would eat that.
And I'm gonna get those tests ordered, and then I will give you a call later today, and we'll discuss more.
Yeah. So I had one other question.
Sure.
So he had a blood test. Is today Thursday? Yeah.
Yes.
Okay. So a week ago he had the blood test. We had to wait until like Tuesday to get the results. So then, the blood test that you guys are going off of, did you do a blood test when you guys took him in and then did another blood test?
Yes. So he's been getting blood tests each day.
Like one?
We're not doing, the testing that he had last week is a full, like, every value in the body blood test.
Yeah.
We're doing a more minimal sampling every day because he also does, which he's had historically, he has a mild anemia.
Yeah, that's why I'm concerned.
So we don't want to draw too much blood.
And that's what happened with my last cat. They took, I don't even want to tell you how much they took out. They took out 17% of our blood in 48 hours. Yeah, it was a nightmare.
Yeah, so we're trying not to pull too much blood, obviously, to limit that.
Yeah.
But enough to just check his kidney values every day, monitor his anemia.
Yeah.
The blood proteins and everything I'm running today, we haven't checked in a few days because we were trying to limit sampling.
Yeah,
and
good.
He didn't
I
have
appreciate
any
that.
other issues that indicated it.
Yeah.
So today we're going to run a bit of a larger panel, though.
Okay.
I'm glad to see him here with you, though. He seems very comfortable and happy.
I'm his favorite person in the world, so it's a big responsibility. He likes this beef baby food. It's not complete cat food, but he's eating it.
That's,
and,
whatever
just
he
trying
likes,
to get calories in right
yeah,
now.
I think that's great.
Okay, Boo. Boo, you're doing good. He hears every noise, but I could tell he's drugged out right now.
Yeah.
Okay, come on. What is he on?
He's getting gabapentin right now.
Oh, okay.
Yeah, just a low dose, but he seems to like it. He seems more comfortable so far.
Yeah, he's spaced out.
I know. Okay, I'm gonna go see if I can get that food for you. Okay.
Yeah, thank you.
Yeah, you're very welcome. It was nice meeting you, and I'll talk with you again later today.
Okay, great.
Here's Boo. He's eating some food. I came to visit him for lunch. And he's been eating pretty good so far. I had a nice long talk with the vet. They're going to do a few more tests today, try to rule out a few other things. And then they think maybe it might be best for him to be transferred to another hospital who can do dialysis. Here's Boo. So he has some fluid buildup under his chin. So he looks like he has a big beard right now. So here's Boo. He's been eating a little bit more food. He's on gabapentin right now, so he's kind of out of it. You okay, buddy? All right, sweetie. Okay, sweetie. You doing okay, boo? You doing okay? You're a good boy. It is 4:27 p.m. Here's Nancy. She's laying on the bed. So I went to the animal hospital today, and I gave Boo lunch because they said he hadn't been eating since I saw him yesterday. Thankfully, he ate some food, and I got to speak to the vet that was there today. And she told me that the biopsies came back, and the biopsies did not show cancer. I guess that's good. And also what happened to Boo overnight is he's building up fluid underneath his chin. And when I saw him, he looks like he has a big double chin. Also, they have him on gabapentin because they said that he was trying to get out of his cage last night. Like, after I went to visit him, like, I know he did not want me to leave. And when he was visiting me in the exam room, like, he was trying to get out of the room. So, like, after they put him back in the cage, I guess he kept trying to get out of the cage. He wanted to, like, leave. I don't blame him. So they ended up giving him some gabapentin just to, like, calm him down, keep him, take his anxiety down a bit. So when I saw him today, he's kind of drugged out from that. They said his kidney levels have not come down. They actually went up a little bit. And they wanted to do another test today to check his protein level to see if maybe his protein is so low that's what's causing the fluid buildup. When that came back, she said his protein was low, obviously, because he hasn't been eating for like 2 days, but it wasn't really low enough to cause that. She also said that she does not think this is chronic kidney disease. She thinks this is acute kidney disease because it came on really fast, and it really more has symptoms of that than like the chronic kidney disease. So that's why what she suggested is to actually transfer Boo to a different animal hospital where he could get dialysis, and he would be on dialysis for a few days to get his numbers down to normal, because she said that the fluids that they're giving there really haven't been improving his numbers. So that's where that stands. And what else happened? So Boo did eat some food. He ate a bunch of wet food that I gave him. He was out of sorts because he was on the gabapentin. And he was super, super happy to see me. I'm going to go back later to see if he could eat dinner. I'm waiting for a call back from the vet because she's going to find out, if he could be transferred to the other animal hospital. And if so, when? Would that be today? Would that be tomorrow? How would that work? He would be there for several days. Hopefully the dialysis would be able to make a difference. What she told me is that for about a third of the patients, it really doesn't help. For about a third of the patients, it does help, like it, shows good improvement. And for another third of the patients, it's like a really, really great recovery from it. It just depends on the condition of the cat and what's causing the kidney issues. And unfortunately, they don't know. They don't know what's causing Boo's kidney issues. So that's why they're suggesting this. They've done all these tests. They're looking around for whatever they could find, and they don't know. They don't even know what's building up the fluid. And I do have to say that this animal hospital is much more equipped than the emergency room Stella went to. It's a day and night difference, like complete difference. Everyone here has been super professional. Everyone here has just been like really great as far as just like the information and everything. And so I'm just going to see what happens. I have to get some stuff done around the house, and then I'm going to go see Boo, bring him some dinner, and wait to hear back from the vet. If he does transfer to the other animal hospital, it's an hour and 20 minutes away. So it's quite a distance to drive.
She has some concern that there is underlying chronic degeneration of the kidneys, where even if we do dialysis, which we would really only do in the acute setting, because the hope is then the kidneys can support themselves after. If we get rid of that acute component causing his kidney values to be high, and he still has that degeneration underlying, then will we do all that and kind of be in a similar spot and never really have his kidney values resolved and still be dealing with this. And she said, we can do it if you understand all those risks and would like to. But she did also give me an estimate that for his case, she would recommend dialysis daily for a 2-week course, which is about $30,000.
Oh my gosh.
Which is obviously very expensive. And then especially if we're not sure if his kidney values will still be elevated after that, she's not sure if the risk really weighs the benefit there. She also expressed, because he seems still alert, he's comfortable overall, he's eating with you, we may do more harm than good in the short term.
With the dialysis right now?
She said that in her experience, cats with dialysis, because when we do that, we're removing some blood volume, removing the toxins from it, and then putting it back in. But there is a moment in time when we're in that cycle where there's less blood in their body. And that can kind of make them feel crummy in the short term before they feel better. And then on top of it, he has this anemia. So it's likely that he would need a blood transfusion if we did dialysis. And she also expressed that currently Red Bank doesn't have a stock of cat blood. There's a back order on that. And so if you were interested, she also would recommend that you went to a hospital that had that supply in case it was needed. So those are kind of her thoughts overall, just discussing his case with her. Additionally, as far as the kidneys, she agreed with me whether we want to consider it now or if he is not eating with you and not taking oral medications well, it's definitely a consideration to do a feeding tube for medication, but also just for the fact of being able to give him water through that, just to keep him hydrated. So I think where we're at now, I'm not sure I would recommend the dialysis. I think it's an option if we want to look into it further. But after getting her input from her experience, I don't know if it's the best choice for Boo.
So the best choice right now would just be to continue the way you guys are treating him?
Yeah, we would continue supportive care. We'll wait on our test results to come back. And we'll see where his kidney values are at tomorrow. And I think if tomorrow we are not seeing improvement, then we decide again, do we want to do another day on fluids or do we wean him off of the fluids and send him home because he seems more comfortable with you as well. Maybe that would be best for him, doing the medications at home. And then I don't know if you've done in the past like fluid injections under the skin, subcutaneous fluids.
No.
We can go through that with you on how to do that at home. That's usually the best treatment for cats that have high kidney values long term. Getting some fluids under the skin each day just to supplement their hydration.
Doesn't seem like there's a lot of choices here, but that's fine.
Yeah, I think, unfortunately we can only support him the best we can. We just have to see how he responds.
I get that. Now, with the fluid underneath his chin, could that be from the collar around his neck? Because he doesn't usually wear a collar.
I think it's unlikely. It's very loose.
Is it
collar?
Very loose?
I can remove it and see if it helps. But I'm not positive, honestly, the exact cause of that. That swelling yet. We took x-rays tonight. And we're waiting on the x-ray, the radiologist report, but we didn't find any obvious cause for it.
That's just something that I was thinking, because usually, when you have something weird, it could be, you never know.
I know. I did give him, in case he was having some kind of allergic reaction too, I gave him an injection of Benadryl to see if that improves it at all tonight, so we can give it some time and see if that helps.
Oh, is that going to make him sleepy?
It can make them a little quiet, but I checked on him. He's not sedate by any means. I think if anything, it's making him more comfortable in hospital.
Because I was going to come by at 8 to give him some more food.
Oh yeah, no, that's totally fine.
All right.
Should be good for that. He'll probably be similar to when you saw him earlier. Honestly.
All right. All right. Great.
Okay with you, that's kind of our plan at this point. Continue the fluids. We'll see where we're at tomorrow, and then we'll come up with a plan from there.
Okay. Sounds good.
Okay.
Thank you.
Perfect. I'll talk to you tomorrow.
Okay.
You're welcome.
Bye.
It is 7 p.m. here, Simba. And I got a call from the animal hospital, I don't know, maybe an hour ago, with regards to Boo's situation. So the animal hospital called the other animal hospital that does the dialysis and spoke to a woman there who's very, very experienced. And they told her about Boo's case. And the woman at the dialysis hospital thinks it's not good for Boo to do it now because of his anemia situation. And she also doesn't want to make him worse than he is. Because of his current condition, she's concerned that doing dialysis, like if it was too soon, could, hamper a potential recovery on his own. Like it could, make him worse. She explained that when, they're doing dialysis, some of his blood is leaving his body and it's getting filtered through the machine. And if he's already anemic, he could require a blood transfusion. And unfortunately, they don't have cat blood there. So she said that there's like a shortage of cat blood right now. She also mentioned the cost. She thinks that it would be like 2 weeks of dialysis and it would be $30,000, which is a lot of money. So she thinks maybe it's not a right time to do it. Maybe potentially if things take a different direction, it would be like a last resort type thing. So the vet at the animal hospital where Boo is right now, as well as the vet at the other animal hospital with the dialysis, they both think it's, not a good thing for Boo to do right now. So the plan is I'm going to go there in an hour and hopefully he's going to eat some dinner. We'll get him fed. And then they're going to just continue the course of treatment. And, they've sent out a few other tests for him. They're waiting test results. And she also mentioned the possibility of letting him just come home and then me administering the fluids here because he'd be more comfortable, he'd be more relaxed, and he eats better when I'm around. And she just thinks just in general he might do better than where he is now in the animal hospital. So that could potentially be good. I just hope he stays where he is now, doesn't get worse. I also mentioned to her that, maybe he has the fluid under his chin because of that e-collar that's around his neck. They have the e-collar around his neck and then they have it tied around his neck. And she said, well, it's pretty loose. And I said, well, but he's not used to wearing a collar at all. And, all these fluids are going into him. So there could be a chance that, they're not draining out of that area properly. So she said, well, we probably could take the e-collar off and see how that goes. So that's where I left it with her. Right now, I'm feeding the cats. That's Simba and Splash's dinner. They're having some leftover raw food, and they're going to try one of the wellness morsels pouches, a little bit of that, and then some crunchies on top, along with some freeze-dried chicken. I don't know where Splash is. I think he's sitting on a chair somewhere. Splash, go and eat. I gave you your dinner. It's in the other room, okay? So yesterday when I came back, Splash and Simba were sitting on cat towers in the living room. I'm going to go put some videos on for them to watch, and I got to go feed the Lucky 7. Another thing that the vet at the dialysis hospital mentioned is that based on her experience, she does not think that this is acute kidney disease. She thinks it sounds more like chronic because, he had been kind of off of his regular food for about a month. It was about a month that Boo, didn't want to eat his normal food, but he would eat other food. He'd eat different food. And it's only, recently that he's gotten picky, but, it does seem like it's something that has been like over the course of several weeks versus something sudden over the course of several days. How you doing, Boo? You're a good boy. You're a good boy, Boo. You're a good boy. They left the line on him because they say they've been having problems connecting it and unconnecting it. So I just put his music on so he'll stay calm. I brought his tunnel for him. Now, will you eat some food, please? Want to eat some food, please? Which food would you like? Okay, eat good, Boo. There's a lot of food here. Okay. Please eat something. Please eat something, Boo. All Boo wants to do is pace around the room, jump on the counter. I think it's because this room is for like gerbils and, what do you call it? Guinea pigs and stuff like that. He smells something. Boo. Please eat some food, will you please? Here. Eat these. Come here, Boo. Come here, Boo. Here's Boo. He just ate a little bit of baby food. He had a little bit of Monterey medley. He's just like grazing today, a few temptations. He hears people outside vacuuming like the hallway, so he's flipped out by that. And I believe in this room they do like, small animals, bunnies, birds, that kind of stuff. So he definitely smells them. Here's Boo. He wants to jump on the counter and just see what's going on up here. He's drinking some water right now. It is 9:40 p.m. Hey, Sammy. Hello, Sammy. There's little Eva. There's Nancy. There's Richard. Hello, Sammy. It is 9:40 p.m. And I just got home a little while ago from visiting with Boo. And the entire time I was with him, it was almost an hour, he did not sit down the entire time. He just paced around the room, hunting whatever he was smelling. I don't know if he was smelling like a rodent, a guinea pig, a bird, a lizard, a ferret. I don't know what he smelled, but that was definitely like a small animal room. He smelled something and he was trying to hunt it. And the entire time he was just like pacing around the room. He wanted to jump up on the counter multiple times, and he had that IV line attached to him, so I had to pick him up and put him up there. Then he wants to jump down, so I would have to pick him up and bring him back down to the floor. So I basically spent an hour chasing Boo around the room. He was not as drugged up as he was earlier today. Earlier today, you could tell he was on the gabapentin, and right now he didn't really seem to be on much of anything. He was afraid of the noises that he heard in the hallway when they started vacuuming, because the cleaners vacuum the halls at night. He was afraid of the vacuum. So he's definitely on edge. He didn't want to eat that much food. He took a few bites of something, he took a few bites of something else. He drank a ton of water, probably drank 4 ounces of water, half a cup. He ate a few temptations. But his focus was really more on hunting whatever he was smelling. So I was disappointed that they would put a cat in a small animal room. And when we were leaving and the vet tech came to get him, I told her what happened, that, he spent the whole time hunting something that he must smell, the small animals, that were in the room previously. And she told me that they usually clean the room pretty well, between patients. But obviously cats have super smelling. So not a good idea to put a cat in a small rodent room, small animal room for a visit. They just get too agitated and they go into hunting mode. At least Boo did. Other than that, he looked okay. He's still swollen under his chin. And I just could not believe how much energy he had. And I put him on the scale. He weighs 14 and a half pounds, but I'm sure a lot of that is the fluids that he's been getting. And yeah, that's the situation. I'm exhausted. Boo just totally exhausted me out. So I hope he relaxes. I hope he gets sleep. Oh, and they brought him into the room in a cardboard carrier, a box. And I was like, oh, he's in a box today? She goes, yeah, sometimes he's really hard to handle when I put him in a blanket. Previously, they've been wrapping him up in a blanket to bring him to the room and from the room. But today she put him in a cardboard carrier because, she said, he wiggles around a lot. Sometimes he's hard to carry. And so what happened was when she was ready to take him back, he always hides underneath a chair. So I have to move the chair, and then I pick him up, and I'm like, okay, Boo, it's nice seeing you. You got to go back now. And when I put him back in the cardboard carrier, he was not happy, and he was hissing at her. So it's exactly like what happened yesterday when she came to get him. He was underneath a chair, and he was like hissing at her. So she is definitely not one of his favorite people, or he just probably doesn't want to leave me, which is more likely the case, because I know he had a great time when I was there and he really enjoyed the time that he spent with me. So when someone takes him away, he does not like that. But at least I'm hoping he gets the idea now that I haven't left him there, that I'll be back to visit him, because like the first time I visited him, he might have thought like, that was the last time he saw me, like I wasn't going to come back. Maybe that's why he was trying to get out of his cage all night. So hopefully he's not going to try to get out of his cage all night again. Hopefully he'll be more relaxed because he'll understand that I'll be back. I'm just hoping everything goes well tonight for him. I'm hoping that, things stay stable throughout the night, and that tomorrow I might be able to bring him home and just do fluids at home. Because the other thing that I was thinking, while I was there, he wasn't really eating much. And it was just like, here we go again. We're exactly back where we are when I took him to, the vet or to the animal hospital to begin with, because he, was being super finicky with his food and he wasn't eating. The only difference is that they've done a bunch of tests and, they've been giving him fluids. But other than that, we're right back where we were. It is 7:50 a.m. Here's Simba. Good morning, Simba. How are you, Simba? Simba threw up a hairball yesterday. And then I think he threw up again just a little bit, but it wasn't anything major. This morning, I woke up with anxiety. I've been really, really good through the whole Boo situation so far as like not dealing with anxiety. It's been incredibly low with everything that's going on. But today, when I woke up, I'm really feeling it again. And the reason why is because of what happened when I visited Boo yesterday. And the fact that, we were put in a room that previously had guinea pigs and birds and ferrets and, those kind of small animals. And Boo was so agitated. He was, constantly walking around the room and hunting. So the fact that, a cat would be put in that type of room for visiting hours, it's not sitting right with me, because I'm like, why would they do that? Like, do they not know any better than to do that? And if they don't know any better than to do that, why? Like, what else do they not know any better to do? So that's the first thing that's not sitting right with me. The second thing that's not sitting right with me is the fact that the vets had brought Boo in a cardboard carrier because she said that she's having a hard time handling him. Now, I know that Boo is hard to handle, but I expect more from vets and vet techs, because that's what they do. Like, when they're working, they're not just handling Boo, they're handling all different kinds of animals, so they have much more animal handling experience, and it should be easier for them. But I know also that the longer Boo stays there, the more unhappy he is there, and that's another thing that's bothering me, that Boo's really not happy being there. And I know that if he has any chance of, healing and getting better, he needs to be in an environment where he's going to be happy and not stressed and be able to relax and not be pumped full of drugs to make him relax. So that's another thing that's contributing to my anxiety. And of course, the fact that I don't know how he did overnight. He's there, and, overnight is always like a stressful time. Hopefully he's stable and he's exactly how he was yesterday. Hopefully he doesn't have any more fluid buildup. I don't know. There's so many variables right now. I think those are the major contributing factors. I am hoping that I'll be able to bring him home today and put him in his room and administer fluids at home and just keep him comfortable here and just, try to get him to improve somehow. But before I can do that, I want to clean out his room. I want to change like the bedding on the day sofa. I want to just give everything a good clean. Hopefully also clean out the closet. The closet is just packed. So I need to empty everything out of the closet and find homes for everything. Organize that. And yeah, that's going to be a big job. It's going to take me hours this morning. So I need to get moving. I need to do some of my vagus nerve reset exercises, like things that I do to get that reset. I'm sucking on a Rescue Remedy lozenge right now. I've had some theanine candy this morning. I need to make sure I hydrate myself, and I need to make sure I eat something. And I just feel like here we go again with this stress and anxiety stuff. I'm gonna try to keep it low. I know it's worse in the morning. It's the worst part of the day for anxiety because of the cortisol levels. So I know my cortisol levels are high. So I need to just start burning that off by getting moving and getting my day started. And I could have so easily just laid in bed this morning. Like, it was that kind of morning. It was just like, okay, I'm just going to give up. I'm going to lay in bed and just, not do anything all day, but I can't do that. That's not productive. So I'm going to move around. If I want to lay on the couch later, I'll allow myself to do that. Right now, I just have to keep moving through the stress and anxiety.
I'm going to go over an update for today with you and talk about my plan at this point. I just wanted to see how Boo did for his visit last night with you.
Boo was hunting the whole time. He did not sit still. So they put us in a room that must have had like guinea pigs, birds, ferrets, whatever. Okay. And he smelled them. And he wanted to jump on top of the counters. Like, he wanted to go everywhere but do anything but like eat food.
Okay.
And it was hard because he had the line. They kept the long line on him.
Oh, okay.
So I had to keep picking him up and, don't jump, Boo, and, keeping him from jumping down. It was like he was pretty much, in hunt mode the whole time. He did eat some food, like he ate a few bites of this, a few bites of that. But he was just so agitated because, he's a hunter. He spent the first 2 years living in the woods, surviving on chipmunks and mice,
Yeah.
So
yeah, I think you were looking to visit again this afternoon, right?
Yeah, I definitely, I want to try to get him to eat, but like also,
Yeah, definitely.
You mentioned that maybe he could come home and do fluids at home. So
yeah, we can go through everything. I think also if you have interest in visiting him this afternoon, we can make some adjustments and maybe put him in a room that he might not smell as much, and we can get the line off and everything.
Okay.
But aside from how he's doing with you, he continues to be alert in hospital, pretty comfortable. He's not eating for us, but he does eat somewhat for you.
Yeah. Now Go ahead.
Oh, he was holding his bladder a lot last night, so his bladder was pretty large.
Yeah.
I think because he's so anxious in hospital.
Yeah, he drank a ton of water when he was with me. He drank a ton of water.
Okay, and I think, he was holding on to that, but then he did urinate a good amount this morning.
Yeah.
I think he probably still has pee in his bladder, but he did pee, so that's good. Unfortunately, at this point, his kidney values have continued to get worse.
Yeah.
So I'm really concerned from his blood work this morning because he's continuing to get worse in the face of the care that we're giving him.
Yeah.
I am concerned, even if it's not a disease, the kidney disease that he's currently experiencing, if it's not something that is fatal right now, it may be in the near future.
Yeah.
Because he's not responding. I did check a blood test this morning, too, to look at the clotting of his blood, because we had talked about maybe he had a clot go near his head, causing that swelling. And so I expect, if I think there's a clot there, I would expect that blood test to show that he's clotting too much. But he's actually not clotting well enough.
Okay.
He's having trouble forming blood clots, so he is at risk for bleeding. At this point, I'm most concerned that swelling around his head is due to vasculitis, so inflammation of the vessels, probably from whatever is also affecting his kidneys, like we talked about, whether it's a cancer that we just haven't diagnosed at this point, or it's that disease, FIP.
Yeah, did you get the
feline
did you get the test results back from that?
So both those tests take about a week to come back.
Oh.
So I'm not sure we will get those, like, enough to help right now. We may get them and they may be supportive of one or the other. But like we talked about, they're not the best test for either of those diseases too, so they could come back inconclusive. I think at this point, because we're in a pretty rough spot, we can consider starting an antiviral therapy empirically without knowing if he has this feline infectious peritonitis, just to see if he improves. If he's going to respond to that drug, we usually see it within the first few days of starting the drug.
Okay.
It is a drug that is an oral medication that he gets once a day for 90 days. It was recently approved through a very specific pharmacy called Stokes Pharmacy that compounds it. But it usually takes a week or two to come in the mail. Since he's declining at this point, we can consider starting. We have some of the drug in hospital that was donated by another owner just to see if it helps. I'm also planning to start some steroids today just to see if there's any response to that. But I do think, unfortunately, we're running out of options at this point.
Yeah.
We can try these things and we can see if they help, but I do still have a lot of concern that there's been a lot of damage to his kidneys at this point that may not be reversible.
Yeah.
So taking that all into account, I think we can proceed a few ways. I think it's up to you. I think we can continue to try to be aggressive within hospital treatment. We can start that drug and see what happens. We also could send him home with supportive care, with fluids, just keep him more comfortable with you and see how he does.
I mean, I would prefer for him to be here because he's not happy there and he's so stressed out there. And I know stress affects the kidneys, like, in a negative way, especially in FIV cats. Like, you know, he's always been that way. So I would rather do as much as I can for him here because he has a separate room here. I'm preparing a bedroom for him. You know, where, like, he would have everything. When he was first rescued, he had to spend 90 days in quarantine. So he was in that room while he was recovering from medical issues to begin with. So he loves that room. And I would hate for, you know, things to go really bad and for him to spend his last days in the hospital.
I agree. I'm on the same page as you, and I think that's very reasonable. It's, like, very obvious he's so comfortable with you.
Yeah.
And he's just so nervous here.
Yeah.
I think that would be good for him to spend time at home.
Yeah.
And we just have to kind of see how he does.
Yeah. So, I mean, I don't know if it's still possible to give him that, you know, the antiviral if it is FIP. I was looking at that yesterday. There's, like, a Facebook support group about that.
Yeah.
And, you know, they say if it is that, you do want to try to get on the medicine sooner rather than later to hope that it works.
Yeah, so I can put in an order for it to the pharmacy.
Yeah.
So it'll get delivered to you, but obviously it takes some time.
Yeah.
I can see, I don't know if we have enough to, like, send you home with.
Yeah.
Just to start for now, I can see what we have in hospital, but you'd be interested in starting it.
Well, I mean, if that's an option, if you think that could potentially be an issue with him, and if it's not going to make...
I do.
You know?
Yeah.
Yeah. So...
Okay. I'll put the order in, and I'll see what we have in hospital.
Okay.
And if we're able to send them home.
Go ahead.
Go ahead.
So the other thing that I found out is that gabapentin does give cats an appetite, which is maybe why he ate so much when I was there, like the other day when you guys had some gabapentin in him. So I was wondering if you could just give me small doses of that so I could try that at home.
Yeah, we can send home the dose that we've been giving in hospital. The dose he's getting here is a pretty low dose.
Yeah.
I'll send you home with that just because gabapentin can affect the blood pressure in the kidneys.
Yeah.
But he's tolerating this dose well. So
Yeah, like,
send some home.
I don't even know if he would need it, but just in case he's not eating well, that's what I'm thinking. The other thing is I don't know if you have another, like, anti-nausea or appetite stimulant that could be used.
Yeah. He's also been receiving anti-nausea and appetite stimulants in hospital. I can send you home with both of those.
Yeah, and then the other thing would be, like, if you guys have prescription kidney food there that he could try just to see if he might like eating it.
Yeah, I can send home some.
Okay. But I mean, I would just hate to see him continue to decline where he is, because I know he's so not happy.
I know. I agree. Okay, so
And then
we'll
with
put that together for him.
Yeah, with regards to the fluids, like, what do you suggest for home fluids?
Yeah, so I can have someone go through a fluid lesson with you in hospital today. Have you done it with cats at home before?
No, I haven't. I've been watching videos on YouTube about it, though.
Okay, perfect. Well, I'll have one of the nurses come in and just go over it with you as well. And I'm going to recommend, I'll have it all in writing, but we do daily fluids.
So it would just once daily, twice daily?
Once daily for now, until we recheck and see how he's responded.
And okay, and it would be like what, 100 milliliters or more than that, or?
It would probably be between 50 and 100. I'll have to look at his weight and everything.
All right.
But I'll have a plan written up for you.
Okay, yeah, I noticed yesterday he weighed like 14.5 pounds, and I was like, oh, that must be all the liquid weight that you guys are putting into him.
He's gained some weight. I think a lot of it, honestly, was his bladder was very, very large last night.
Yeah.
But I'm also concerned that he's retaining fluid because of the fluids we're giving him, and his kidneys aren't able to process it normally.
Okay.
Mm-hmm.
All right. Okay. All right. So
I'm going to put this together for him. The other thing I just wanted to mention to you, I know we talked about he has that anemia that he's had that has gotten a little worse in hospital, which is not unexpected because we've been giving him fluids and all. I did start a medication last night, an oral medication, to try to help his red blood cells go higher. So I'll send him home with that as well.
Okay, yeah. So, like, what time could I come by and do all this?
Yeah. Would you be able to come by at 6 o'clock tonight so I can put everything together, have the pharmacy ready, and we can go over everything in a fluid lesson and all?
Yeah, I could do 6 p.m.
Perfect. We'll do that, and I'll see you then, okay?
Well, should I still come by to try to give him lunch or no?
Up to you. If you'd like to come by, we could definitely do that this afternoon, too.
Yeah, I'd like to come by maybe around, like, 1:30.
Okay, perfect. I will let the front desk know again, okay?
Thank you.
I'm here visiting Boo. They had a cone on his head, and he still has this line on him. They won't take the line off of him. Boo, you want other food? You want Friskies? Come here, Boo. Boo, you want Friskies? Eat some Friskies, please. You can eat it. No one's bothering you. I'm here to visit. I'm here to visit, Boo. Boo, you're going to go home today. You're going to go home today, Boo, okay? Want to eat this? Here you go. Eat that one. Eat that one, Boo. You okay, buddy? Okay, Boo? You all right? You want to eat over there? You want to just hang out in the corner? Boo's walking all around. He's saying, I'd rather get some exercise than eat. But Boo, you gotta eat. You gotta eat some food, okay? I brought you food. You gotta eat some, okay? Eat the food, please. Eat the food, please. Boo almost ate a full meal. He ate quite a bit of Fancy Feast, and he tasted some other foods. Mostly wet food today. But mostly what I did was I chased him around the room and made sure he didn't get his line stuck on anything. He's in good spirits right now, and his chin swelling has gone down, so that's good. It is 2:40 p.m. I am trying to get out of this parking lot. I'm running a few errands on the way home, so I saw Boo today. I actually got him to eat some lunch, because he doesn't eat if I'm not there. He ate half of a Fancy Feast, and he ate some other food that I'd given him, just some little, some licks of various other canned food. And so I think he got close to a full meal. He also ate a churro. He was in good spirits. He had a lot of energy. They did keep that line on him, which I wasn't happy about because it means I have to chase him around the room, make sure it doesn't get stuck on anything. And other than that, he had really good energy level. He was in a decent mood. I could tell, he's on those drugs. So that is what it is. But it was a good visit with him. He was happy to see me. I told him that I'll be back in a few hours and I'll be happy to take him home. I think he's just going to do better. I hope he's going to do better at home. I know he's going to be more relaxed. I know he's going to be happier. So maybe that'll make a big difference in any recovery. So where it stands right now, you know, it could go in either direction. He could get better or he could get worse. We don't know. So we're taking everything just like one day at a time, 1 minute at a time. That's all we could do.
Can we take this off?
Yes, yeah. All of this can absolutely come off. I would rather do it with you in the room. He was getting like a little bit fussy in the back, and I didn't really want to stress him out anymore. So
Yeah,
I just figured.
so stressed out.
I know,
right
so
now.
I just figured I would bring him in, and we'll just take it off together.
Yeah.
All right, baby. There you go. There you go, sir. There you go. And so I'll grab a scissor for that. But I am just here to show you how to do his fluids at home.
Okay, do we need him to show? Like, can I put him in the carrier, or do you need him out?
Yeah, he can absolutely go in the carrier. Yeah, if anything, I can actually just show you because we just need his back area,
Yeah, like-
so I can
like
just
around
exactly.
here.
Yeah, so he can totally go in, and then we can. Yeah, if anything, we can just open it a little bit.
Oh, the top opens. It's easiest.
Oh, perfect.
If you put it on the ground, he'll be happy to go.
He should be.
Okay, but we're going home, buddy.
Oh, I see.
Yeah, if you just take the towel off the top.
Oh, it's one. Oh, I see what you mean.
Yeah.
All right, buddy.
There you go. There you go. He's never been so happy to go in the carrier.
No, and then he has a, as you saw, a little bandage.
Yeah,
on his
that's
left.
where the line was.
Exactly. Yeah. So you guys can take that off in like an hour when you guys get home. All right.
Okay.
All right, mister. And they gave you everything at the pharmacy, right? Like
I
all
haven't been
his-
to the pharmacy yet.
Okay.
So she just called me to let me know that another pharmacy is going to be calling me.
Have you ever given him any type of like injection under the skin or anything like that?
No,
Okay.
he's thankfully has been really healthy
Yeah.
other than teeth issues, and then all of a sudden this came up, so it's just weird.
That's horrible.
No.
Alrighty, so you're going to be giving him 50 mLs. There are syringes in here, so you can measure them in the syringe. So you don't have to worry about keeping track of this bag, because this can be.
What do you mean measuring in the syringe? Isn't
So
this like measurement on the bag?
Yes, that is a measurement on the bag, but to be a little bit more precise, we give people syringes. So you can actually draw up the fluid directly from the bag
Into
here,
there.
yeah, and then you can measure it exactly to 50.
So
And then you don't have to like be, kind of going in between the lines and stuff like that.
Oh, so then this, I would have to.
I'll show you exactly what to do. So we have needles in here, we have syringes, and then butterflies. So the needle and the syringe is what you're going to use to draw up, and then the butterfly is how you're actually going to give it to him. So the only thing that's going to poke him is the butterfly. These needles are not going to be poking him. This is just to get it out of the bag. So we're just going to screw this onto here.
Can I do it?
Yeah, absolutely. Yeah, I want you to do everything.
How does this open?
It twists off, actually, the top. Yeah. And we'll give him like a little bit right now. He already got his fluids and everything, so he can get like 5 or 10 mLs right now.
Do I have to open this?
Yeah, it twists off the bottom. And then it just twists right onto there.
This?
Yep, exactly. And then you can...
Or does it push in or twist in?
It twists on. Yeah, you don't have to push it. It should be tight. Yeah, you only have to twist it a couple times.
Like, is there supposed to be a space?
Yeah. No, it's on. It's
That's
on.
fine.
Yeah.
Okay.
As long as it's, attached and
Okay.
it's not wiggling, that's good.
Yeah.
Okay, so you're going to stick it. This is like the port on the side. You don't have to go through here. We can just go right through this
Does
port.
this
and
unscrew?
No. This keeps it sterile. So this reseals after we poke it.
Okay.
Whereas this will be like a little hole that will make this all not sterile.
Okay.
So we're going to go into this little port with our needle.
I'm going to do it now?
Yeah, if you want, just so that we can practice and then we know that you're totally comfortable at home.
So here's the needle.
Yep,
And then I'm just
go
gonna
right
in the middle?
Yep, there you go.
And then
just drop a little bit. We're not going to do the whole thing right now, so you can just get a little bit in there. There we go.
Good enough?
Yep, that's good. Okay, and we'll come out. Be really careful. So how I tell people to do this is to scoop up the cap of the needle
with that?
Yeah, exactly. So that you're not like trying to put it on.
Recap it?
Yep, recap it, twist it off. And then we're going to replace it with our butterfly. So.
Oh, take this off.
Yep, you can take that off the syringe. So theoretically, this is filled up to 50.
Yeah.
And then we'll take one butterfly. And then this is going to screw on exactly where the needle was. So this also has a little cap at the end. You just pop that off, twist it off, and then you can put that right on.
It just goes in like.
Yep, exactly. Yeah, you don't have to keep twisting. It should just be like one twist on.
Okay.
Yeah, you don't have to. Okay.
Okay.
So there's some air in this line here, and we don't want to be injecting with air. Mm-hmm. So just go over, your kitchen sink or whatever. You can take this cap off, and then you can just squeeze a little bit out just to get it all through the line. So as soon as you see it coming out, you're good, and you don't see any bubbles in there. We're all good. Mm-hmm. So you're good to go. And then I will show you.
Is that the needle already?
Yes, this is the needle. So it's very small. And honestly, I have to say, giving fluids, I think it's the area that this area is just really not very sensitive. Yeah. They really don't react at all. It's a very easy thing to do. It's not like he's going to be screaming. So I can show you. Hi, baby.
Yeah.
Hi.
So it would. Actually between the shoulder blades,
exactly,
right? And
right there.
Just tent it.
So you can tent it, and then make sure you can feel like where you're gonna poke, which is right under his skin, right there. And obviously, if you have someone who can hold him, that's
hopefully when he's home, hopefully he'll be more relaxed.
And I think he will be for sure.
Yeah.
So then, baby, I know.
Then the needle would go in kind of parallel to him.
Exactly. So I'll show you if you want to just kind of keep him a little bit still. I like to tell people to just angle down just the slightest bit instead of directly parallel. So instead of, here, I'll put this just so we don't accidentally poke. Because you can very easily poke through the other side of their skin. Yeah. So that's I think the biggest problem people run into. Mm. So I would say just angle your needle down just a tiny bit, just to make sure you're getting into the subcutaneous space. All right. I know. Boo-boo, you're going home, honey. Going home. I know, we're going to miss you too. I know, you can't wait to get out of here, dude. Okay, so do you want to try poking? I can hold him still a little bit for right now.
Sure.
Just so that we can make sure that you're comfortable to do it.
Yeah.
Okay, Bubba. Okay, Bubba, I know. Yeah, if you want to come this way, I can turn him around.
No, that's good. I was just trying to figure out, doing this with one hand, how do you keep this elevated at the same time?
So you don't have to keep the syringe elevated.
You don't?
Yeah, so that's the nice thing that's the other reason we give them to people. You can just, use it like you would use any other syringe.
So where's his?
So that's, right there is perfect.
Right
yeah,
here?
anywhere in that region is totally good. I know.
Like here?
Yep, exactly. Yep. Just make sure you're not too near your own finger.
Well, that's what I'm doing.
I know, baby. It may be easier to.
Okay, there it is.
Okay, all right. So just squeeze down now a little bit. Yeah. Perfect. I know, Boo. I know.
So he doesn't like how it feels, right?
Yeah, it's just it's a little cold, and sometimes.
Should I warm it up?
We don't advise warming it up. You can always make sure that it's sort of room temperature.
Yeah, that's what I'm saying.
Yeah. And you don't have to keep it in the fridge or anything like that.
Do you have to go a certain speeds? Fast,
Nope. You can give it as fast as you want. Okay. So if you really want to just get it over with, okay. And then we can just.
How do you take it out?
Okay,
just take it out.
Yep, exactly. Okay. Perfect.
You did so good, Boo.
You did so good, buddy.
You did so good,
I know, Boo Boo. Hang on. No. I know.
We're going home.
You guys are going home, Boo.
Boo, we're going home. Boo, we're going home. Boo, we're going home.
Buddy, you don't have to stay.
Boo, we're going home. He's trying to escape.
I know.
He just wants to get out of here.
I know. All right, and then so I'll take that from you. So these never ever read.
Yeah, we never read.
I'm
just taking it day by day right now.
I know. So that's why I don't want to get too far ahead of ourselves.
Yeah, I'd be happy to be like, oh yeah, I'm gonna need 1 million.
I know.
I just don't know.
I know. Alrighty. So do you think you're comfortable doing that?
Yeah.
For now? Okay.
Yeah, that's fine.
Okay.
I thought I was gonna have to, hang the bag up.
No, I know, and that's what's really nice about these is you don't even have to worry about that. You don't have to worry about this being in any.
So the Abril antibiotic.
Yes.
That's in case he has an infection, or does he have an infection?
We are waiting on the culture from his urine, but in the case that there's some kind of kidney infection compounding this issue, rather just be safe.
So that's once a day.
Yes.
Does it matter what time?
No.
Okay. And then the GS441524.
Yes.
That's twice a day.
Yes, that one, we had some in-house, so I drew up syringes for doses for 3 days, and then I put your script into the pharmacy, so they should be in contact with you. They're putting that in, and it should get mailed to your house.
Now, did he get that already today?
Yes.
Okay. Does this affect his kidneys?
It shouldn't. Like, it doesn't have side effects on the kidneys. If anything, the hope is if there's FIP affecting the kidneys, will it help them?
Okay, so that should not make any kidney issues worse.
It shouldn't.
Okay. Because I was just looking stuff online in the FIP group, and there was concern about that. So that's why I just wanted to ask you. So we went over the ringers. Does that matter what time of day, or is it just easiest time to get it for him?
Yeah, whatever works for you.
Okay. So this is the steroid, and the purpose of that is for?
Because his kidneys are so inflamed, in case the steroids may help them.
Okay.
We started that today just because we haven't seen improvement with other treatments.
Okay, and does that matter what time?
No.
Okay, and then it says do not stop abruptly. So what does that mean?
So that medication should be discontinued as a tapering course.
Okay.
So I recommend you follow up with your regular vet in 3 to 5 days, have him re-examined, have his blood work rechecked, and then discuss with them at that point.
Okay, so that's an issue that I'm having because when I went to his regular vet, it took us 5 days to get the blood test and the urine test, which I'm not happy about.
Okay.
Would I be able to just bring him back here?
Yeah, for the first recheck at least, definitely. I can do, I'm not sure if I'd be able to see him long term. I can see if one of our internal medicine specialists may be able to.
Yeah, like maybe there's someone else if not you.
As far as when I would want him rechecked, 3 to 5 days. The next day I'm in hospital next week is Wednesday. Yeah, I can definitely do that first appointment, then I'll see, just because it's Friday at this point, a lot of the clinicians are gone for the weekend, but I could see it next week. We could facilitate something for further rechecks.
Yeah, okay. And the Varenzen, that's for the anemia.
Yeah.
Okay, every 24 hours. So can he eat these in food, or do they have to be injected into his mouth?
He can eat them in food. It's unlikely that he's going to get the full dose, though, if it's mixed in food.
Well, I usually give it like an appetizer portion. Like when I had.
If you put them in and he will eat them in food, that's okay. Generally, they're not so tasty that cats are going to want to eat them in food. Yeah. Usually, we have to give them orally.
Okay, is that how he's been getting them here? Okay, and then the gabapentin, Mirataz. I mean, those are optional, right?
Yeah, those are kind of as you think you need.
Yeah, because I think hopefully once he's relaxed and everything, he should be better. But I'll have them in case I need them.
Definitely.
Okay. Definitely. Fresh water. He could eat whatever he wants. So he doesn't need a phosphorus binder or anything like that? No,
not right now. Most importantly, I just want to keep him eating right now. And sometimes the phosphorus binder can make them not want to eat.
Okay.
So we're just going to focus on that for this point.
Okay, and as far as food, can I try some of the kidney food here? Do I just grab a few cans?
I did.
Can I get a tub of those Churu Nourish also?
Yeah, if you want to check at pharmacy, I'm sure they can help you out. I did send up labels for kidney food for him. They may have it waiting up there, and it's just for you to grab on the way out if they didn't give it to you. Yeah.
Yeah, I don't know. I didn't see what's in the. Yeah. Okay. We'll see how it goes. Yeah. Hoping for the best,
Yeah. And I'm here tomorrow, and then I'm here Sunday.
Okay. Is there a direct number or an email or something?
I don't have a direct number, but I will give you a call tomorrow.
Okay.
I'll call you, I'll check in, I'll see how he's doing, and then we can go from there.
Okay. Sounds good.
Okay.
Great. Thank you so much.
Yeah, you're very welcome.
It is 7:30 p.m. and here's Bowie's home. He's still in his carrier, and his entire room was refreshed for him today. I cleaned everything. I washed the floor, vacuumed the floor, did all the laundry. I did all the linens on his bed, put fresh towels underneath everything, a fresh sheet, fresh blanket, quilt. I put his bed in the wash. There's lots of comfy pillows. Over here by the window, I put a new runner by the window. And over here, I brought a TV in so we could hang out, watch TV. Here's a CD player. And then down here, I moved the color changing litter over here. And then he has regular clay litter here. He could use either of those. I took some of the plants out that were over here. I put them in my greenhouse. I don't know if they're going to survive. I just kept the snake plants here for now for some greenery. Also, snake plants are supposed to help filter the air. I do have this air purifier running over here. Boo has fresh water, and I gave him a Delectables bisque, just something light to eat if he wants it. And he's being such a good boy, so I'm going to let him out. You want to come out? How you doing, Boo? You're home. He's probably going to go straight for the water or for the food. How you doing, Boo? I wonder if he peed in the carrier. I have to check on that. Yeah, I think he peed in here. Yeah. Oh, he pooped. Did you poop? You pooped and peed. Okay, we gotta wipe you. We gotta wipe you, Boo, okay? Okay, and I gotta take your necklace off. I just wiped him down with some pet wipes. So Boo spent quite a bit of time in that carrier. He's been in there for an hour and a half because when I got there, I had a 6 p.m. appointment. Okay, so maybe not an entire hour and a half, but close to an hour and a half. They gave me a lesson on how to give him fluids, which is very different from all the videos that I watched on YouTube. So that was great. And then I talked to the vet, went over all of the medications. So Boo's on 4 medications plus the fluids. And there are then 2 optional medications, which is the gabapentin and also this other appetite stimulant that you put, I think you rub it in his ear or something like that. So that's what's going on. Most of the medications are once a day. The FIP medication is twice a day. And if that's successful, he'll be on that for like 84 days, something like that. So I'm hoping for the best. And we're just taking everything one day at a time. I'm hoping he's just going to be so much better now that he's home. Right now, he's still drugged up. You know, they have him on, like, everything today. So we'll see if he eats something. And then tomorrow, I start him on, like, all the medicines at home. And it's going to be challenging. I asked them if I could give him the medicines and food. And she's like, yeah, if he'll eat it. But they've just been giving it to him straight in his mouth. So depending on how Boo is, that could be easy to do or that could be difficult to do. Right now, I was able to like wipe him down with these pet wipes and he let me do it. So that was good because normally Boo is really not a fan of that. So I am just going to let him relax in here. I have to take the carrier out and clean it up. And I'm going to go do that outside before it gets dark. And I'm glad he's drinking water. The goal is to get him drinking water and eating food. He does have another vet visit in 5 days for a follow-up. I'm going to follow up with the same doctor that has seen him for the past 2 days. And then after that, she said maybe I'd be able to get appointments with one of the internists there or specialists or something like that. So we'll see. It's 8 p.m. and here's Boo. He drank a whole bunch of water. Now he's here underneath the day sofa. I think he just wants to relax, which is fine. I have his music on, and I have just a little lamp, no bright light. I just turned the brighter light on so I could film this. And I hope he's doing good. I hope he's feeling okay. I have to take the bandage off of his arm, but if he's just going to relax there, then that's fine. Okay, Boo, you relax. You relax, baby. Boo has used this new scratcher several times now. He's also jumped up on the shelf to look out the window. And I took his bandage off of his leg. He did not like me doing that, so I had to distract him with a brush. So if I brush him with one hand and then remove the bandage with the other hand, he lets me do that. So that might be how I'm going to have to, like, do fluids for him. We'll see, because he's drinking a lot of water. And I don't know how much water they were giving him in his cage. Like, I always give the cats, like, massive water bowls. Like, that's a pretty big water bowl for a cat. It's really like a dog bowl. So I think he's going to be drinking a lot more water now that he's home. And just because he's more comfortable, he's still out of it. So I expect him to continue to be kind of out of it until, you know, some of the drugs wear off, like the gabapentin. That's an optional drug. The other ones aren't optional, but we're just taking it one day at a time and seeing how it goes. I fully expect him to take a few days. Like, Usually what happens is like the first day he'll be active in this room. Like when I'm thinking back on like other instances where, he's had issues, he might come back and be like active for a day or half a day, like tonight. Then he might spend a few days really just sleeping and relaxing and, in recovery mode. So we're just taking it one day at a time and seeing how everything goes, right, Boo? If we could keep him stable like this, then it's good. And if we could see improvements, it's even better. And that's what we're trying to do. I would like to get him to eat some dinner. So that's what I'm going to try to do. He's been eating like around 8 o'clock when I've been visiting him. And right now it's 8:30, so it would be a good time for him to eat something. Okay, Boo, what are we going to try to eat today? What are we going to try to eat today? It is 9:45 p.m. Here's Boo. He is relaxing. I ate half of a sandwich for dinner, and I'm drinking some lemonade. I just gave Splash and Simba some crunchies. They're not happy with their dinner, but they're eating crunchies. And what I did a little while ago is I got some of the like waterproof blankets that Sharon made for the cats. She actually made these for the couch in the living room, but I put it here on the day sofa underneath like the sheet and underneath the blankets, just in case Boo pees on the sofa. I don't expect him to, but he's been in the hospital. He's on medication. Like, I don't know. I don't know how he's going to be, so I just wanted to be sure. It is 8:56 a.m. and here's Boo. And he relaxed last night. I don't know how much sleep he got because, whenever I was looking at him, he wasn't sleeping. He eventually did use the litter box. He peed a few times, pooped a small poop. He drank a lot of water yesterday when he got home. And he didn't eat much food. He ate like a little bit of food, definitely not like a full meal. And this morning, I gave him 2 of his medicines already. So he has his medicine that's supposed to help with his anemia. I gave him that one first because I figured, I haven't given a cat medicine by mouth in a while. Let me practice on that one. So if something happens, he spits out the dose or something, then like it's not terribly bad. But after I gave him that one, then I gave him his FIP medicine. That he has to have twice a day, and that's the one that, I have to make sure he gets the dose. And what I had to do is I had to like wrap him up as much as I could. I also had to practically sit on him. He did not like that medicine. Like he was really making horrible noises, but eventually I got, I would say 95% of it in him. Then I let him relax for a little bit. I gave him a churro as a treat. He didn't want it. I gave him little tiny pieces of ham. He ate a few of them. And then let him relax a little bit. And I've been trying to get him to eat some kind of breakfast, but he doesn't want to eat anything. Like he took a few licks of some Fancy Feast savory centers, and he took a few licks of the kidney wet food that the vet gave us to try. But he's not like eating a full meal, so I have to figure out how to get these calories into him. I also tried some of the kidney dry food, and he didn't eat that. Now, when he was in the hospital, from what I could tell, he only ate when I fed him and like I'd get there for lunch and dinner. So maybe he's just not used to eating in the morning for the past 3 days or so. Also, one of the medicines, so I have to give him 2 more medicines as well as the fluids. And one of the medicines requires, food in the stomach. It's an antibiotic. It says with food. So that's why I'm trying to get a little bit of food into his stomach so I could give him the other medicines. So the other one that's left is the antibiotic and then the steroid. The reason why he's on the steroid is to try to bring down the inflammation in his kidneys. Okay, Boo? Also from the animal hospital, I picked up a tub of the Churu Nourish. I haven't tried those with him yet to see if he likes them. They have double the calories of a regular Churu. So the regular Churu has like 6 calories. Those have like 12 calories to try to get some calories into him. But other than that, he seems to be doing good. I was absolutely surprised at how much he fought me today with those medicines. I was like, oh my gosh. He does want to leave the room, but I don't want him to leave the room until he gets the rest of his medicine, until he eats something. I'd rather he just stayed in this room and relaxed, because he needs to sleep today. Like, today needs to be a sleep day for him. I don't know how much sleep he got in the animal hospital. He really didn't get a whole lot of sleep last night, so I want today to be a sleep day. What would you like to eat, Boo? What can I give you that you'll actually eat? Now, I can give him the appetite stimulant. You rub it in his ear. I could try that and see how that works. I wanted to try to avoid like as much of the unnecessary medicine as I could, just to like, you know, give his body a chance to recover. The less medicine it's processing, the better. But, you know, if he's not going to eat, I might have to try that. Okay. It's 9:09 a.m. Here's Boo. He was relaxing comfortably, and I wanted to show him to you, but now he's getting up. So I'm going to shut the door. Boo, you got to go relax, okay? I'm going to take a shower, and when I come back, you're going to eat more food, okay, Boo? Okay, go. You're not coming out. You're not coming out. Here's Simba. What I was going to say is that I just got a call from the pharmacy that will be sending the rest of Boo's FIP medication. It ends up that they're about 2 hours away, so they're going to ship it, so I don't have to drive down there. I guess it's not widely available, so it's pretty expensive. It's like $610 for, I think it was like a 20-day supply, and he's going to need to be on it for 80 days if we see improvement on it. So that's the situation. Supposedly it's a new drug that was very recently approved in the United States, so maybe that's why. But anyway, we're going to give it a try. So I'm going to try to get moving, try to get more food into Boo and see what we could do. It is 7 a.m. and here's Boo. And I slept in here last night. I should say, you know, Boo took his medicines last night. He got his subcutaneous fluids. He did so good with that. He did so good. And then what happened was, in the middle of the night, Boo jumped on top of me because he likes laying on top of me. And I noticed that his breathing was like really heavy. Like I've never felt him breathing that heavy before. And so I was like saying, okay, well, maybe he's just, you know, hyped up. I don't know if he was like walking around the room. I said, let me see if he'll just calm down a little bit. But his breathing never calmed down. So that's not good. He's still breathing really, really heavy. So I have to take him back to the animal hospital today. I'm actually waiting for Grandpa Farrell, who should be here in about an hour. And he's going to help me because I only got 3 hours of sleep last night. Like, I don't even know how I'm functioning right now. Boo drank a ton of water this morning. He also drank water yesterday. Now, if Boo does have FIP, there's something that's called wet FIP, and he could be having fluids accumulating in his chest and his abdomen. And that is what could be causing his heavy breathing. If that's the case, they can drain some of those fluids and restore his breathing back to normal. And, you know, he's currently on, today would be day 3 of his treatment for FIP, I believe. I have to check into that. Hopefully the treatment will work. But, you know, I don't know for sure if that's what's going on with him. It could be fluid building up somewhere else. It could just be something totally different. But I definitely have to bring him back today. Hopefully he'll cooperate. Hopefully they'll take him right away because he is critical. And He's such a good boy. I love you so much, Boo. I want you to feel better, okay, buddy? I want you to feel better, my sweetie, my sweet Boo. So that's where that stands. I have to get myself dressed and ready to go. I put the screen door in Boo's room so he can see Splash and Simba. I don't want to take him out of his room right now because I need to get him into a carrier sooner rather than later. And I don't want him hiding like underneath something. I just want to keep him as calm as possible. And it's just easier to try to get him into a carrier. But I did put the screen down so the cats could see each other. Simba's been growling at him because, obviously Boo doesn't smell the same after being in the hospital and everything. He's still breathing really, really heavy. And, he's definitely not himself. So I'm working on getting the carrier ready. And so we could take him back. I called the animal hospital to let them know that we're coming in. It is 9 a.m. I just got Boo in the carrier. This is what I have to do with this room. So I have to take everything off the day sofa. Then I have to take the cushion off the day sofa and block anywhere he can run. And then I have to take the frame and turn it upside like that. Then I had to grab a towel and put Boo in the carrier with the towel. So for a cat that's breathing really heavy and supposedly doesn't feel well, he still has a lot of energy and a lot of fight in him. So we're going to see what the animal hospital says.
Taking a look at him, he's breathing very heavy.
Yeah.
He now has a heart murmur.
Okay.
He now has abnormal lung sounds.
Okay.
And he has a lot of fluid in his chest.
Yeah.
I believe at this point, I don't know if this is related to FIP at all. We're not even sure he has FIP.
Yeah.
It's very possible he doesn't and he just has kidney failure.
Mm-hmm.
I believe that he has now gone into heart failure on top of the kidney failure from the fluids. I think his body just can't handle what's going on, and I think his organs are all starting to fail now. So in addition to his kidneys, his heart is failing, and it's causing this fluid in his chest and trouble breathing. He's very sick. We're not seeing improvement, and he's getting worse.
So there's nothing that can be done?
So I think the only thing we can consider at this point that I don't even think I would recommend would be admitting him back to the hospital. He needs oxygen therapy and injectable diuretics and have that fluid removed from his chest. If you are inclined, we can do that again, but knowing that, he doesn't seem to do well in hospital, and he's very sick, and I do think he's suffering at this point. And I do honestly recommend humane euthanasia today. I know we're trying everything for him and we're hoping he'll get better, but he's just continuing to get worse.
It sounds like there are no other options.
I think that we're kind of at that point where we've done everything and it's just getting worse.
But do we know what's causing this?
Unfortunately, we don't. All I know is his kidneys are failing. They're very, very large still. I suspect his kidney values probably went up since he was last here because they were continuing to go up. It's possible that it could be FIP or a cancer, but we haven't found anything so far that really tells us that's what it is. I think it's possible we could wait a week for the FIP test to come back, and it might be negative. And it might not be FIP. My biggest concern at this point is that this could be just something congenital and underlying. If it's not an infection or cancer, it may just be that his body has done this and he can't compensate for it anymore.
It is 1:10 p.m. and I don't have any cats to show you right now. All the cats are hiding somewhere. Simba has been out socializing, but I don't know where he is right now. But Boo passed away today. He passed away this morning. He was humanely euthanized at the animal hospital because when he got there, he was breathing very, very heavy. And they took him to the back and they examined him. And they found out that he had a massive buildup of fluid in his chest area and in his lungs and around his lungs. And he had a heart murmur and his heart was giving out. So he was starting to go into heart failure. They felt that there really wasn't anything else that could be done for him because he had been going into kidney failure last week. And if they were to treat the heart failure, it would aggravate the kidney failure. And treating the kidney failure aggravated the heart failure or even potentially brought on the heart failure. So Boo is dealing with his organs shutting down. And he was having a lot of trouble breathing. So they put him immediately in an oxygen tank and were administering oxygen to him. And basically said that he could go into cardiac arrest at any minute. And if I was to take him home, he could last hours or he could last days, but he would be suffering because he was having trouble breathing. And I know that for a fact because when he jumped on me in the middle of the night, I could feel that. I could feel he was having trouble breathing, which is why I made the choice to bring him to the animal hospital this morning. So there was nothing more that could have been done for him. We did everything. And I'm at such a loss right now, especially after everything I've been through over the past 2 months. Stella passed away a little more than 2 months ago. Like right now, it's April. It's April 27th. And my birthday is tomorrow. This is such a horrible birthday. And Stella passed away on February 6th. And the grief that I feel over Boo is completely different from the grief that I felt over Stella. The grief that I felt over Stella was mixed with anxiety and anger and trauma based on what I had witnessed and experienced with her in the emergency room that she went to. And when Boo was at this animal hospital, I honestly thought that maybe the reason Stella passed away was to save Boo's life. Because if Stella had not gone to that emergency room and had not passed away, I probably would have brought Boo there instead of the animal hospital where I brought him instead. And I do have to say that during the time that he was at the animal hospital, I do feel like he got really good care. And I do feel like the vets that helped him really cared about him. And the vet that was there today was the same vet that was helping him for the last 2 days when he was hospitalized. So I'm glad that's the case because I'm glad that she sees the results of her care. And I'm not saying she was negligent. I'm not saying she was incompetent. I'm just saying, you know, when you go to an emergency room or an animal hospital, the vets are, you know, like rotating. You don't always get the same vet. It's kind of rare that you do. So the fact that she had been treating Boo the majority of the times when he was hospitalized and then she was there today to put him down, I think that's how it should be. The most difficult part of it was that Boo did not want to go. When Stella passed away, she was extremely ill. Her body was basically lifeless. The same thing for Ditto, the same thing for Hydrox. They were all so extremely ill. They just laid there on the table and you just knew it was like, okay, it's time. The last time I saw Stella alive, I did not share photos of that because it's too disturbing. She was on oxygen and she was basically just laying lifeless on the table. And I knew that if something happened to her overnight, she most likely would not be conscious during that. But Boo, today, he was completely alert. When I held him, I could feel him taking such deep breaths because he could not breathe. But other than that, he did not want to go. He wanted to walk back and forth on the counter in the exam room, and then he crawled himself into the corner behind the sink, and he did not want to leave that corner. And I spent so much time just petting him and loving on him and telling him it was okay to go, that I'll take care of Splash and Simba, and he could go be with Stella, and he could see Hydrox and Ditto. But he did not want to leave. I could not pick him up because he tried to fight me. Grandpa Farrell petted him for a long time, said his goodbyes, and Boo would not budge. Finally, the vet decided that maybe we could move him out of the corner and then be able to pick him up and put him on the exam table. And that's what happened. So when Boo was finally moved to the exam table, I held him very tightly as he was given the injection to sedate him. I felt his body relax. And then he was given the injection that stopped his heart. And then the vet checked to make sure that he had passed. And he had passed. And that was the absolute most difficult cat euthanasia that I've ever experienced. Because other than not being able to breathe, and obviously his kidneys shutting down, his heart was shutting down, his organs were all shutting down. Mentally, he was absolutely alert. He did not want to go anywhere. I told him that he doesn't have to stay here for me, that I'll be okay. His kittens will be okay. All the cats will be okay, and he could just go be with Stella, but he still did not want to leave. And that's what made it so hard. But what made it a little tiny bit easier is that I knew that if he stayed here, he would just be in pain and he would end up suffocating to death because he couldn't breathe. And I would not want to put him through hours of suffering, days of suffering. I don't think he would have lasted more than a few days. And I would not want to just have him suffer like that for days, where he can't breathe and he's just struggling to breathe until he took his last breath. And to be honest with you, when I was sleeping here last night, and then when he jumped on me and I felt his breathing and I knew something was wrong, part of me felt like this was him saying goodbye to me. Because if I had not slept here and if he had not jumped on top of me so that I could feel him breathing, I probably would have not realized the extent of how serious everything is. Because sometimes if you just look at a cat breathing, it's completely different than if you actually feel them laying on top of you and breathing. And he kept shifting positions, and first he was laying on my stomach, and then he was laying on my side, then he was laying on my legs, and he just kept moving around. And I remember thinking, is Boo trying to say goodbye to me? But then in the morning, when he had so much energy and he had so much fight in him and he ate 2 of the liquid cat treats, I was like, wow, this is great. He's eating. And he did not want to come out from underneath the day sofa. He did not want to go anywhere. I honestly thought that maybe there was some hope for him. I don't know where I left off with what I was saying before. I had someone drop in, so I spent some time with them. And now I'm downstairs. So this morning, I just fed all the cats some dry cat food and picked everything up and went to the animal hospital with Boo. Being home again, this time without him, knowing that he's gone, it's such an empty feeling. I think this lump is Sammy. I might have been talking about how difficult it was to put him down because he still had so much energy in him. I knew it had to be done because he was having such a hard time breathing. And there was no way that they could clear the fluids out of his chest. And there was no way that they could repair his kidneys or repair his heart. So after the vet was finally able to scoot him out of the corner where he was, planting himself because he did not want to go anywhere, we brought him to the exam table. And I held him so tightly for 2 reasons. 1, because I didn't want him to squirm off the table. And 2, because I did not want to let him go. And even as I was holding him, I could feel how much he was struggling to breathe. And so the vet gave him the injection that calmed him down. And then she gave him the injection that stopped his heart. And I petted him and I held him and I said my goodbyes. And I can't believe he's gone. I can't believe he's gone. It literally feels like it was just a few months ago when he was living outside and I was socializing him and training him and getting him ready to be a house cat. But that was almost 8 years ago. And I just feel like I didn't have enough time with him. The same thing I felt with Stella. I feel like they were taken away from me too soon. I did not have enough time with them. I honestly thought that they'd be at least living till 17, 18, 19 years old, if not more than that. Because I always did everything to try to keep them healthy. I've always gone out of my way to buy them the healthiest foods and to make them homemade healthy food. And then this happens. And so my entire view of anything cat food related is once again shattered. And my entire view of anything cat health related is once again shattered. And I'm questioning everything because nothing makes sense. And I'm also very disappointed in the fact that all the time that I've had Boo, people have said to me, well, he's FIV positive, but that doesn't really mean anything. It doesn't change their lives. They can live long, healthy lives even though they're FIV positive. Why didn't anyone ever tell me that if a cat is FIV positive, it makes them more susceptible to diseases like FIP? I still don't know if Boo actually had FIP, but if a cat has FIV, they are more susceptible to FIP because their immune system is weaker. Why didn't anyone tell me that a cat with FIV has 6 times a greater chance of getting lymphoma than a non-FIV cat? I mean, these are just 2 things that have come up over the past few days that I never knew about because everyone, even vets, only ever told me, oh, well, a cat with FIV, they're okay. They could live their whole life. It's fine. As long as they're taken good care of, they'll be healthy. If I would have known, then I could have made changes. I could have had Boo on supplements for years with regards to either of those issues. I could have made changes that could have changed his future. And it's mind-boggling to me that I never came across that information until the past few days. With all the books that I've read about cat health and cat nutrition and all the videos that I've watched and all the articles that I've read, why is it that I've never seen that information before? And why is it, again, that I have another cat that nobody really knows why he died or what actually caused his passing? I mean, that's what happened with Stella. There's no definitive reason for her passing. No one can tell me exactly what was causing the level of ketones in her body that were making her feel so bad that I took her to the emergency room. Now, I do know that she eventually passed because the emergency room mishandled her and took out too much of her blood. And she would have had a chance to survive if she had gone to the animal hospital that Boo went to. But even the animal hospital that Boo went to, yeah, we know that he was brought there because his kidney values were elevated. But why were his kidney values elevated? 8 months ago, they were perfectly fine. What would cause them within the past 8 months to become so elevated? It doesn't make any sense. So I'm very, very disappointed in the veterinary establishment. Why doesn't anybody have more information with regards to cat health? Why is everything always a mystery? Why is everything always guessing? And that's what I'm tired of. Every vet that I go to, everything is always a guess. Whether it's the animal hospital, whether it's the emergency room, whether it's the holistic vets that the cats have gone to, everything is always a guess. Well, it might be this or it might be that. Nobody ever knows. I'm so tired of that. And look, it is Sammy. Hello, Sammy. How are you? You being a good girl today? I know it's a strange day today, Sammy. It's a strange day. What I've been doing today is laying on the couch and watching TV. And that's all I want to do. I don't want to do anything today. I just need to rest and recover. I don't feel the need to write everything down like I did with Stella. With Stella, everything was going through my head, just going over and over and over it again because nothing made sense. Nothing made sense. Boo is different because I didn't have the level of trauma or neglect or incompetence that I did with Stella. I do feel like the animal hospital that we went to did what they could for him to the best ability that they could for him. The only what ifs that I do have, the biggest what if that I have is what if I just refused all treatments? What if I said, you know what, you could give him fluids and if his numbers don't come down, then I'm just going to take him home and I'm just going to give him supportive care and then that'll be that. I'm just going to, make him comfortable, give him some quality of life, and that'll be that. I honestly think he would have lived longer. And maybe, potentially, his condition could have been reversed because I ordered all the herbal supplements for the kidneys, for his lymphatic system, in case he had lymphoma. I have them all here. I ordered them all from multiple companies because I said in case one, he doesn't like eating, in case he doesn't like the flavor of this one, I'll use this company. And I was ready to do that. I was completely ready to do that. And then the animal hospital kept, throwing different things at me. Well, maybe he has an infection. We're going to give him antibiotics. And now we're going to give him steroids to bring the swelling down. And now we're going to give him a drug to bring his iron up. And now we're going to do this. And now we're going to do that. And honestly, I think it was just pharmaceutical overload. Completely. If he's going to heal his body, his body needs strength to do that, and it needs support. It does not need a bunch of chemicals pumped into it. And I really feel like that is what weakened everything, because if you have a weak body to begin with, and then you start pumping all these chemicals and pharmaceuticals into it, it's only going to make it weaker. It's not going to make it stronger. And that's my big regret with Boo. That is my biggest regret with Boo, because there is not a doubt in my mind that if he had not gone through all of these pharmaceutical drugs and everything that they were pumping into him, he would have at least gotten a few extra weeks of life, maybe even a few extra months of life. If we look at Ditto got 5 months. 5 months. Boo got 5 days. That's my big regret with Boo. That's my what if. But there's nothing I could do about it now. I just have to, accept the fact that he's gone and grieve his loss and miss him every day. I'm scooping out this color-changing litter in Boo's room, and I'm seeing quite a bit of blue, dark green, which indicates a health problem. And here it says, alkalinity outside of the average range may be present if your cat has certain types of urinary tract infections. Highly alkaline urine can increase the risk of struvite crystal stone formation. I also think that maybe the cocktail of pharmaceutical drugs that he was on changed the pH of his urine. But what this does go to show you is that this color-changing litter definitely works. And this is the Pretty Litter Health Monitoring Cat Litter. And the reason why I put it here in Boo's room for the past few days is so I could monitor what was going on. And I did not see Blue prior to now. So he would have used this overnight. And this would have been another indication of a health issue. If I had not noticed his breathing, I would have seen this dark blue here in the litter box, and that would have alerted me. So if you're dealing with health issues in your cats, you think they might have health issues, definitely check out this Pretty Litter. It could potentially help your cat. So I'm cleaning out the litter boxes in Boo's room, and I just realized that a week ago today it was Easter. And on Easter, Boo was acting absolutely fine. He was so happy. I had family over the house, and he was so happy visiting with them, and he was playing with toys, and he was running around the house, and he was jumping up on top of cat towers, and he was in such a great mood. The only thing that was off was that, he was being super picky with what he was eating. That was the only thing. I had 4 or 5 different cans of food open for him to try, and, he was being super fussy. At that time, we're still waiting for test results. It was another 2 days until I got the test results and then took him to the animal hospital. But that's how fast things change. Literally, in a week. A week he went from acting totally normal, just being fussy with his food, and his kidney numbers were high, and now he's gone. He's gone because he had a chest full of fluid in his lungs, a heart murmur, a weakened heart, enlarged kidneys, a mottled spleen, thickened intestines. So much. It just goes to show you never know. It is 3:38 p.m. and I'm downstairs. I'm doing a whole bunch of laundry, all cat laundry, all the blankets and everything that was in Boo's room. And I just realized why Boo's passing is hitting me so differently than Stella's passing. And that's because when Stella passed away, my heart was broken. It felt like it was just ripped out of my body. And now with Boo's passing, I don't feel that. The reason why it's not breaking my heart is because my heart's already broken. I've been walking around with a broken heart since Stella passed away. So how do you break a heart that's already broken? Boo's passing is still breaking my heart, but it's just on a different level than Stella's passing did. It's 9:36 p.m. I was just going to go to bed, and look who I found in Boo's room. So Simba is all stretched out on the day sofa, which is fine. And here's Splash. And Splash was on top of the cat tower. But I think he heard me moving around, so now he moved. You guys want to squeeze up? You want a churu? Want churu or squeeze up? I'll give you a treat. So what I was gonna actually sleep here tonight and put the TV on and watch some TV. But if they want to stay here, that's fine. They can hang out in here. The room's nice and clean right now. All right, guys, you want a treat? It is 8 a.m. and here's Simba. He's in this bed on top of the armoire. And I don't know if you could see some of Splash's white fur, but he's under the bed already. The reason why is because I do have a family member that has been staying with me or stayed with me overnight. And so this is what Splash does. He comes out at night, but then during the day he hangs out under the bed. So last night, two really cute things happened. The first thing was probably around 9:30 p.m. I was going to lay on the day sofa in Boo's room and watch some TV. And so I turned the light on and I was like, okay, I guess I won't do that because Simba was all stretched out on the day sofa and Splash was in the cat tower. So the two of them were so cute together in that room. And I was like, okay, guys, I'm not going to bother you. But then, I don't know exactly what happened, but Splash got spooked and then like he left the room and then Simba followed him. So I was like, okay, I guess I will lay down in this room. So I ended up sleeping in Boo's room last night. I started by laying down on the day sofa watching TV and then I just fell asleep and I was like, I'm just going to sleep here. And it felt good to sleep there because I felt closer to Boo by doing that because the room has been like completely cleared out, but it still feels like him. It just reminds me of him. So I slept pretty good there. But what happened was around 3 a.m. I woke up and I was thirsty and I was like, I gotta get some water. And then I was like, I wonder where Splash and Simba are. And I look and the two of them are laying on my bed together. I've never seen that before. Usually it's only like maybe Simba, but this time it was Simba and Splash. And I was like, that is so cute. And these are the dinner plates for the Lucky Seven. So I fed them dinner yesterday, but they didn't eat it. Like when I went to bed, I checked on them and there's still food on the plates. What they do is if someone's visiting the house, they usually all go into hiding, which is what they're doing now. Oh, I see Sammy's head on a shelf. And then once the house gets quiet, then they come out. And so that's what they did last night. They came out and they ate their dinner. So that's good. One of the things on the agenda today is to go to Target and get some more of that pretty litter, the color changing litter, because I'm going to put it in this litter box. That way, when the cats use it, which will mostly be Splash and Simba, then I'll be able to see what's going on. I'm actually wondering if I can like maybe even get rid of one of these litter boxes. So with the OG4, it was obviously 4 cats, Stella, Boo, Splash, and Simba. And up here, I have anywhere between 4 and 5 litter boxes. When I say 5, it's because we were testing out the pretty litter, the color changing litter to see how that goes. But let's say on average, I always have 4 litter boxes for 4 cats. Now with only Splash and Simba, I don't really need 4 litter boxes. I just need a litter box here, like 1 litter box here, 1 litter box in my room, and 1 litter box in the like main living area. The reason why I do it that way is, you know, if for some reason a cat is in my room with the door shut, they have a litter box. If a cat is in here with the door shut, they have a litter box. If a cat's in the main living area and, you know, the doors are shut, they have a litter box. Obviously, the Lucky Seven are in the house. They can use any litter box that they want, like when the doors are open. But I always have to think, like, okay, if for some reason a cat's in a room, the door's shut, do they have a litter box? So I could actually probably get rid of one of these. Maybe that'll be something in the future, because I do want to see how they like to use the color changing litters. I mean, Boo has been pooping and peeing in it, so he didn't have a problem with it. Splash and Simba, I believe they've been peeing in it. I don't know if they've been pooping in it. So I definitely want to at least have 1 litter box in the house that has that. And so since this room tends to be the room where cats go if they have like a health issue, if they need to recover for something, I think this would be the room to put the color changing litter. In which case, maybe I would put it in this enclosure eventually. I mean, this is fresh litter yesterday, and this was all cleaned out yesterday. The house feels so quiet and empty without Boo. You have to remember that Boo is my greeting committee upstairs. Like whenever I got up in the morning, whenever I came home, he was the happy cat that was greeting me. So it's a very different experience today. Even though he was in the hospital for 3 days and he wasn't here, it just feels way different knowing he's never coming back versus, oh, he'll be out of the hospital in a few days. What's going to be really interesting is to see how Simba and Splash evolve now that Boo's not here. So with Boo, he was always very possessive of me. He always felt that I was like his territory, and he would often do things to let the other cats know. So for example, here's the play rug. And what would happen is like I'd get down here and this is where I'd be. And I'd be like, okay guys, you want some crunchies? And Stella would be here, Boo would be here, Simba would be here, and then Splash would come in and he'd be here. And what would happen is that if Splash came over here, well, Splash would always go to Stella first because, you know, Stella was his mom, so he'd always rub up against Stella, headbutt Stella. But sometimes he'd come around Stella and, you know, want pets from me, so I'd be petting him, at which case Boo would then come over here and kind of be like, no, get away, you know, I'm in charge of this territory over here. And then after Stella passed away, I noticed the same thing kept happening. So like without Stella here, Splash would come over here and like he'd want pets and I'd pet him. And then Boo would get, I don't know if he'd get like jealous or what, but then he would come over here and he would be like, you know, this is my territory, you know, back off. So I noticed that like a few times happening. And I was like, okay, that's really interesting. And I would make an extra effort to give Splash pets, whether it was over there on a scratch and roll or in another room or whatever. And Boo and Splash have always had a strange relationship like that, because even when Splash and Simba were kittens and living outside, like I'll never forget, I would hear like a cat screaming, and then all of a sudden I would see Splash come running across the patio, and then like Boo would be chasing after him. And sometimes I thought that they were playing like that Boo was like teaching him, and then at other times I wasn't so sure. So Boo and Splash have always had a bit of a relationship like that. Like Boo has always been a little bit tough on Splash, more of a disciplinarian with Splash than he was with Simba, although he was also a disciplinarian with Simba. Over the years, I always felt like maybe Boo was trying to toughen up Splash, be like, okay, Splash, you know, don't be such a wishy-washy, just, you know, toughen up a little bit. So it'll be interesting to see how Splash's behavior changes without Boo here. And to be honest, everything just feels so surreal. It kind of feels like the last 9 years were just a dream, like a really good dream. And now it's over. I'm waking up today to a completely new reality. One that I would never expect. A week ago, I would never expect this. A month ago, I would never expect this. A year ago, I would never expect that I would not have Stella or Boo here. Like, how does this happen? Today we're trying this pretty litter clumping cat litter. So the pretty litter that I had previously did not clump. Like you just scooped out the solids and then like where the cats peed, you just kind of like mixed it back in. And I did not notice any like strong odor from it or anything, so that was fine. But I saw this one, and this one says it's clumping, so I thought I'd give this one a try first. So I just put some in this litter box and we'll see if the cats use it, how it works, and then as this empties out, like as I scoop out the clumps, I'll just refill it with the regular non-clumping litter, and you know, we'll just see which one I like better and which one the cats like better, if it makes a difference for them or not. It is 3 p.m. and here's Simba. He's still laying on top of the armoire. This is what's left of his breakfast. I had some canned sardines. And here's Splash. He's still underneath the bed. He ate all of his breakfast. I'm going to remove that plate. All of the litter boxes are getting scrubbed today, so it's a good day for that. It's nice and sunny out. This is the breakfast that I gave to the Lucky 7. They've pretty much been hiding all day, so it looks like maybe they're going to be eating some of this for dinner. I don't know if they're going to be coming out soon. But here's Sammy. She was just in the window. Sammy's getting to be the brave one. Sammy, are you the brave one? You're the brave one? Yeah? You watching the litter boxes get scrubbed? You watching the litter boxes get scrubbed? Come here. Give me pets. Come here, give me pets. So earlier today, I went out and got a few errands done. Went to Costco, went to Target, went out to lunch. I am in absolutely no mood to celebrate a birthday today, so I'm just kind of like going through the motions. I opened some presents this morning that a family member sent me and, went out to lunch today. And I'm not in the mood to celebrate. Like, I just want to sit around and be sad over Boo. Like, I still can't believe what happened yesterday. I still can't believe that he had to be put down yesterday. And I know it was the only thing that could be done because he literally could not breathe and his heart was giving out. I just don't know how he got to be in such bad shape so soon. Like, it happened so suddenly, literally within a week. In 1 week, he went from, being totally fine other than, not wanting to really eat his food to, having to be put down because his organs were shutting down. I'm still trying to wrap my head around that. With Stella, I was trying to wrap my head around like everything that happened in the emergency room, like the entire 3 days that led up to her passing. And with Boo, I'm just trying to wrap my head around such a sudden decline over 1 week. It's 7:45 a.m. and here's Splash. Good morning, Splash. How are you, baby? Splash was up pretty much all night. I looked at the security cameras this morning, and Splash ate a lot of the food that I left out. So Simba was really picky with his dinner yesterday. So what happened was yesterday, I knew I was going to be out of the house all day. I didn't know what time I was getting home. So I set up automatic feeders for the cats. I set up 2 up here, 1 for Splash, 1 for Simba. And I set up the automatic feeder downstairs for the Lucky 7. And I left here around 11 a.m. So everyone had their breakfast, but Simba did not eat his breakfast very well. Like, he really wasn't hungry for breakfast. And I thought, well, maybe it's because he ate food 4, 5, 6 o'clock in the morning, because I watched that on the security camera. He ate some food early in the morning, and I was like, okay, maybe he's not really hungry. So I left him some dry food. I left him his, raw food for breakfast. Splash eats good. Splash is my good eater. And then I was like, okay, the automatic feeders are set up. Simba had an automatic feeder, Splash had an automatic feeder, and I put an automatic feeder downstairs for the Lucky 7. So when I leave, I shut the door between the upstairs and the downstairs. And that way everyone should be able to, eat their food, and nobody's going to eat anyone else's food, and everything should be fine, and no fights or disagreements or anything. So that's what I did. Well, what happened was, an hour and a half later, or 2 hours later, I decide to check the security camera footage. And what do I see? An hour after I left, I see Sammy and other members of the Lucky 7 walking around up here. Now, I don't know how they're getting that door open. Somehow, they're getting that door open. And that's not the first time it happened. It's happened multiple times in the past. So I got to figure this out. I got to figure out who's opening the door. I believe it's Sammy. And it's only happened since I put up that screen door. So part of me thinks maybe she's climbing up the screen door to the doorknob and somehow getting that doorknob open. I don't know. The reason why I don't think it's Nancy is because last night at 5 a.m., I heard Nancy banging on the door and crying at the door because she wants to come up. But I was not going to let her up because last night Nancy came up and she ambushed Splash. So what's happening now, because Boo's no longer here, is that Nancy comes upstairs. When she wants to come upstairs, she'll run upstairs and run around the house. And usually the first thing she does is look for Boo. And, she has eyes for Boo, so she'd keep an eye on Boo. Now she runs around looking for Boo, but then she doesn't find Boo, which is kind of sad. But then yesterday she fixed her eyes on Splash, because I think what happened is that Splash was laying in a cat tower in the room. Splash is black, Boo's black, and his back was to Nancy. So Nancy saw the black fur. So I think Nancy thought, oh, maybe that's Boo, or she thought, well, I'll just ambush Splash instead. And it's not like she was ambushing Boo, in the past she did. But, Boo stood up to her and Boo smacked her around a few times. So Boo was not having any of her ambushing. So he was kind of used to it. Look at Splash. He's getting comfortable. So now, hopefully, I hope she's not going to just start, going after Splash. But maybe Splash is going to blossom and bloom into a little bit of a different personality now. I don't know. We have to see. We're taking it one day at a time. But anyway, so what happened was I saw that the Lucky Seven came upstairs yesterday when they weren't supposed to. And all I thought was, great, they're going to eat the food out of the feeders and Splash and Simba are not going to get any food. So thankfully, I was not on an overnight trip. Because if I was on an overnight trip, I probably would have had to found a way to come back. But I was not on an overnight trip. I knew I was going to be back in the evening. I ended up getting back around 8 p.m. So sure enough, the Lucky Seven ate all the food out of Splash and Simba's feeder. And since I didn't come home too late, what I did was I put them all back downstairs. Then I gave Splash and Simba some dinner. And Splash ate his, and Simba ate a little tiny bit of his. He really didn't want to eat much, and I didn't know if he was having an upset stomach. Simba is very much affected by Boo's passing because Simba and Boo were buddies. Boo was probably closest to Simba than anyone in the house as far as like relationships go. I mean, he was very close to Stella too, but he wasn't buddy-buddy with Stella the way he's buddy-buddy with Simba. Like, Boo and Simba hang out all the time in Boo's room or in my room or wherever. Like, the two of them can be buddies. So that's why it's really bad for Simba right now, and I have to give him a lot of extra attention. And, if he doesn't start eating soon, I'm probably going to have to take him back to the vet. So Simba went to the animal hospital like 2 weeks ago, like 2 weeks and 2 days at this point. And his blood test came back fine. So I might have to take him to the regular vet and maybe do another urine test, because the urine test indicated that he was like dehydrated. His urine was highly concentrated. And the vet said to, get the urine rechecked and see, if the values change. So I might have to do that with Simba, but with everything that's been going on and with all the stress and with Boo, there was no way for me to take Simba to the vet because I was so just tied up with Boo and running to the hospital every day. I'm going to see what's going on with Simba today and then maybe have to make another vet appointment for him. How you doing, Splashy? You're a good boy, Splashy. You're a good boy. I got to brush Splash. A little fur's coming off of him. Good morning, Simba. How are you? He's laying under the day sofa in Boo's room. He likes it here when he wants privacy. Hey, Simba. Good morning. You want to eat some breakfast later? We're in a little while. You want to eat some food today? You want to eat some food, Simba? How you doing, buddy? How you doing, buddy? You okay, Simba? I woke up around 5 o'clock in the morning and Simba was laying here by the window, so I opened the window a little bit for him. I kind of felt bad for him. I was like, who's he looking for? Like, is he looking for Boo? And I gave him a churu, and he did not want it. I'm surprised nobody ate it, because Splash then jumped up by the window after Simba left, and I don't know. I guess they don't like churus. It's 8:15. Simba jumped on the bed to get brushed. Simba, you're so handsome. You're so handsome, Simba. It is 12:20 p.m. and here's Ringo. He's hanging out here on top of the cat tower in my room. All of the members of the Lucky Seven are so happy because they're upstairs today, or they are wherever they want to be after pretty much being downstairs for the past 3 days. But it was really their choice because, they could have come up if they wanted to, but they were too afraid. But I do have to say that the day before yesterday, at night, they did come up. They came as far as the hallway, they were looking around, and then when they saw strange people, they ran downstairs. So they are showing some improvement with regards to that. And now also, they don't always just go into hiding if someone new is in the house downstairs. After a while, they do come out and walk around down there, so that's good. I'm having a difficult day with regards to thinking about Boo because I miss him so much, and I still can't believe he's gone, and I can't believe how fast the past 8 years went. From July of 2017 when he showed up at my back door all scraped up and I knew I had to help him. I was with him just about every single day since then. And then in September, 2 months later, that's when I took him to the vet and he became a full-time house cat. I spent so much time outside working with him one-on-one. I spent hours every day training him, socializing him, getting him ready for being a house cat. And then when he became a house cat, he was in quarantine for 3 months by himself in that room or, outside of the room, just away from the other cats until we knew he didn't have any contagious diseases. He didn't have leukemia or anything like that. So that was a lot of one-on-one time with him then also. And where do the years go? They just fly by. And he's another case where I would never expect him to die so soon. I honestly thought I had at least another 5, 6, 7 years with him. I always knew he was FIV positive, so I thought maybe he'd reach, 15, 16, 17. I never thought I'd lose him before he even hit 10. Both Stella and Boo are estimated to be about 10 years old in a few months in June. That was their estimated birth date. Maybe they're going to be 10 in May. Maybe they were 10 this month. All I know is that they're just about 10 years old right now because they were probably a little bit less than a year old when Stella had her kittens. And right now, Splash and Simba will be celebrating their 9th birthday. They were born in 2016. So their 9th birthday is estimated to be sometime around the end of April or early May. So this is a horrible birthday present for them also. They lost both of their parents within the past few months. And I'm just trying to be as, positive and normal for them as I can be. And I really need to get everyone back onto a normal routine, but I'm still in shock over Boo. I mean, one day it's Easter, he's acting perfectly fine, having a great time. The only thing is he doesn't want to eat his food, which, cats do that all the time. Sometimes they just don't want to eat their food. And then a week later, he's gone. He's just gone. His organs have just shut down and he's gone. It's shocking to me. And it doesn't even seem real. And it makes me so sad. And I miss him so much because he was like my soul cat. Both Stella and Boo. If there's such a thing as a soul cat, they were like my soul cats, but in different ways. Stella took my heart with her. When she left, my heart was just pulled out of my chest. It was just broken open. And then Boo, I feel like he took a part of my soul. The connection that I had with both Stella and Boo was so deep and so profound and so unique. It will never be the same with other cats ever. I don't care who, I don't care when. It's different. The connection that I have with Simba and Splash is different. The connection that I have with every member of the Lucky Seven is different. Some of the members of the Lucky Seven feel like strangers to me, like Ringo, Eva, and Goldie. I mean, they've been living in my house for years now, but I still can't even pet them. Here's Simba. He's laying on the cat tower in Boo's room. He just had a little bit of dry food earlier just because I wanted to see if he would eat something because he only ate about half of his breakfast, and he did eat some. So he's relaxing. The window's wide open. It's a beautiful day today, and I do have the screen door in. So the screen door is zipped up, so there's lots of air flowing through. I'm debating as to whether I want to go for a walk and then sit in the sun. Take about an hour just to, take care of myself and then get to work today. I'm trying to catch up with some stuff, and that's what is really hitting me about Boo, just because, Boo would either be sitting somewhere near me in a cat tower or, hanging out in a cat tower in the next room, or he might be here by the window. But he was always just so joyful and so happy, and I miss that. It's 11 p.m. and here's Simba. And I just put the mouse game on the iPad for him. He's never seen it before. Stella used to play this game. I think I gave it to Boo a few times, but it was really for Stella. But I showed it to Simba. He's pretty interested in it. Look, Simba. Get the mice. Hit it with your paw. Simba, hit it with your paw. Take your paw. Hit it. Ready? Here. Hit it. Hey, get the mice. Get it with the paw. Put your paw on it. Look. Simba, look. Look. Look, Simba, look. Get him. Get the mice, Simba. Get him. Hit him with your paw. Hit with your paw. Hit it. Ready? You could eat him. You gotta hit him. Ooh. See, you did it, Simba. You did it. Hit him again. Hit him again, Simba. Hit it. He's purring. Hit it with your paw. Hit it. Hit it with the paw. He doesn't like it when I do that. Simba. Don't be mean to me, Simba. So, Simba ate his dinner, the majority of it, and then he had crunchies. He, inhaled his crunchies. And then we had some playtime. And right now I'm just about to get ready for bed, and Simba jumped on the bed. So I gave him this mouse game to look at for a while. And we're starting to get back into more of a regular routine, hopefully. Hopefully things are going to calm down and we'll get back into a routine. So Splash and Simba have a tiny bit of crunchies in their automatic feeders overnight. I know you know the name. Simba loves that word, crunchy. So they have maybe a teaspoon that'll give them a little treat maybe around 2 a.m. and then another treat probably around between 4 and 5 a.m. Just enough to keep Simba's tummy happy so he doesn't throw up between meals. And he did good today, so he had a little afternoon snack. He had a few crunchies, and then he had one of those spoon squeeze up things. And then a little while later, I gave him another little squeeze up thing. And then he ate his dinner, so it's good. The goal is to get them more on a regular schedule, which will be the case if everything goes well tonight. They'll just have a little tiny bit of crunchies overnight, and then hopefully this morning everyone will be eating their breakfast, and that'll be good. And the Lucky Seven had all of their leftover breakfast for dinner. So they didn't eat the breakfast. So what I do is I collect it up and I put it in a storage container in the refrigerator, and then I serve it to them for dinner. And they ate that. Then I gave them, I think 2 more cans of food, split among the 7 of them, and a few crunchies, and that'll get them through the night. And we'll see if they ate breakfast. You tired, Simba? You're tired? Simba's depressed because, Boo's not here and Stella's not here. Simba misses his mommy and his daddy, right, Simba? So I'm trying to give Simba lots of extra attention. So earlier this evening, after all the cats ate, Nancy wanted to come upstairs. So I was like, okay, Nancy, you could come upstairs. And she runs upstairs, through the kitchen, down the hallway to the living room. And then she looks for Boo, because that is what she always did. She would just run upstairs all excited and then look for Boo. Except Boo's not here anymore. So it's kind of sad to see her do that. But that's what she did. And then she's a little bit disoriented, well, where's Boo? What's going on? So I tell her, I said, Boo's in heaven with Stella. Boo and Stella went to heaven, and that's where they are now. But then something really weird happened, which Nancy's never done before. So Nancy's on the play rug, and I was sitting on the couch, and then I went over to Nancy on the play rug, and I was like, what's going on, Nancy? You want to play? You want some treats? What's going on? And then all of a sudden, she just turns around and hisses. And there was nothing there to hiss at. Simba was in Boo's room. Splash was in the dining room. Nobody was anywhere near her in the direction of where she was hissing. So I was like, who is she hissing at? Like, what is she hissing at? So it got me wondering. I'm like, I wonder if she saw like Stella or Boo in spirit. You know, they say cats, can see spirits. So I was like, well, I wonder if maybe she saw Boo in spirit or Stella in spirit or something like that. And that's what she was hissing at. But she's never done something like that before. Like, Nancy has never just hissed at nobody. It was very strange. It is 7:30 a.m. and here's Simba. Good morning, Simba. Good morning, Simba. So Simba jumped on the bed this morning and he got a whole bunch of pets. I've always felt like I've been able to communicate very well with Simba, like mentally, telepathically. And this morning I was listening to a video about that and I was like, you know what? Let me just test this out with Simba. Let's see what happens. So Simba was kind of like laying on my arm, like resting his head on my arm. And I was sending him a mental message. And I was like, Simba, tap my arm with your paw, like the opposite paw, which would have been like his left paw. If you understand what I'm communicating with you, please tap my arm with your paw. And guess what? He did. So I was like, oh my gosh, I'm totally connected to Simba. And I've always felt like I've been connected to Simba. It happened, the first time it happened was like many, many years ago, pretty much when he was still like a kitten. I don't even think he was 1 year old yet. And it was Stella, Splash, and Simba. And we were all downstairs and we were hanging out. And they were the only 3 cats living in the house at the time. And I remember it was at night, and I think I was sleeping down there with them. Like, I was going to sleep on the couch down there with them. So I was starting to drift off into sleep. And I was trying to, like, communicate with them telepathically. And I remember all of a sudden, like, hearing Simba talk to me in my head. Like, it was the strangest thing. I just remember, like, thinking to myself, oh my gosh, that was Simba. And I'm able to, like, really communicate with him. So through the years, I've always felt like Simba and I have good communication, right, Simba? So that's why this morning, when I was testing that out, I was like, wow, that's like really validation. So Simba's a good boy, and he's getting lots of extra attention because, he misses his mommy and he misses his daddy, and him and Boo were buddies. Yeah. I think out of all the cats in the house, well, obviously Simba is closest to Splash. Out of all the cats in the house, Simba's closest to Splash. And then second to that would have been Boo, more so than Stella. Like, Splash is closest to Stella. Splash is closest to Simba first, and then Stella second. Even though Splash is a mama's boy, him and Simba are brothers, and they've always been together. They've always been like a pair. But then with Splash, he was closest to Stella, and with Simba, he was closest to Boo. Simba's really feeling Boo's loss. I mean, Splash is too, but Splash seems to be, I don't know. I mean, he just seems to go with the flow, kind of. He just seems to be very accepting of situations. He doesn't really let situations disturb him. But obviously we know Splash is, a very fearful cat. He's timid with many things, but he likes a routine. And from what I could see so far, he just carries on. Splash is really good at carrying on with regards to the loss of Stella and Boo. I think Simba's been feeling it more. Okay, Simba? So Simba and Splash did good overnight. They ate the little bit of crunchies that were in the feeder. And I'm going to get dressed and give everyone breakfast, get everyone brushed and combed. Right, Simba? Simba says he's very comfortable right now. Okay, good boy. Good boy, Simba. It's 8:15 a.m. and here's Nancy, right? Here's Nancy. And here's Simba. Simba's keeping an eye on Nancy. Wherever Nancy goes, Simba's following her. He's saying, I'm keeping an eye on you. Now, Simba got brushed. this morning. And here's Splash. And Splash just got brushed here in this cat tower. He let me brush him for a very long time. He was really enjoying it. When I stopped, he was like, oh no, don't stop. But he looks good. I brushed him really well, got all kinds of loose cat hair off of him. So now I'm going to empty out the brush and I'm going to comb the cats. And maybe Splash will let me comb him while he relaxes in this cat tower. It is now 8:18 a.m. Let me tell you what just happened in the past few minutes. So after I cleaned off the brush, I said, well, Nancy's here. She's in the hallway. Let me brush her. As I'm brushing Nancy, I could tell that something went through her mind where she's like, okay, now I'm going to attack Simba. Because in the past, she's done that. In the past, when I've brushed Nancy, for some reason, she takes it as permission to like ambush a cat. So that's what she just did. She went running from the hall and ambushed Simba where he was sitting on the scratch and roll. And he didn't like it, obviously. So he ran into the dining room and under a chair. And then he was like, you know, howling back at her. So once Nancy misbehaves like that, then I tell her that she needs to go downstairs and she understands what I'm saying. So what did she do? She ran into my bedroom and she's hiding under the bed. So I shut the door. And that's where she's going to stay for a while because she has to learn to behave. And that is why I don't let her up here with the other cats like 24/7 because she can't behave. If she behaves, then she can spend more time with them. Right, Simba? Okay, so now we are going to get combed. Splash was letting me comb him as he sat here. The minute I turned the camera on, he jumped down. It is 3:22 p.m. Here's Richard and Nancy. And that is Sammy meowing at me. She's rubbing up against my legs because she wants a treat. Every time I step into the kitchen, this is what she does. She just keeps meowing at me until she gets a treat. What you doing, Sammy? Just relax, just relax. You had a bunch of treats. Here's Ringo. He's hanging out in this cat tower. And here's Simba. He's hanging out by the open window in my bedroom. So Simba and Splash have been in my room today because it's a beautiful day. And I had to get out of the house early this morning. So this morning, the TJX stores, which is like Home Goods, Marshalls, TJ Maxx, they were having like an early shopper day if you're like a rewards member there, which I am. And I haven't been to one of these like early shopping days in quite a while. They usually have it like before holidays. So I think the last one I went to was before Christmas. And I think they did one like in March, which would have been like before Easter. Then they did one today. They're also going to do it tomorrow, which is before Mother's Day. So I figured, like, let me go, let me just see what they have. I could use a few new clothing items for the summer. Maybe I'll look around TJ Maxx and see what they have. Well, I got really lucky. And when I went to TJ Maxx, they had a bicycle. They had a Schwinn bicycle, right, Simba? So I got it, and I'll show it to you later when I go outside. And then I went to Home Goods. I didn't get anything. I was like looking at the cat stuff. They had beautiful cat towers in Home Goods. So for example, if I wanted to replace this one, they had the exact same one in Home Goods. But I don't know if I want to replace these right now just because I have so many vet bills that I still have to like pay for and take care of. So I might like put off replacing these for a few months. And then I came home, but then I went back out and I ran a few more errands. One of the things was going to a local supermarket and buying some chicken so I could make some raw food for the cats. So that was good. And what happened was just as I was getting home, like just as I pulled into the driveway, I got a phone call from the animal hospital and I was like, okay, it's either going to be the billing department because I still owe money from like when Boo passed away, or it's going to be, you know, the vet and she's going to have the test results that I wanted. Well, sure enough, it was the vet and she had the test results. So I went over those with her on the phone. And, you know, she was very apologetic over everything that happened with Boo. You know, she felt really bad about the whole situation. So the FIP test came back negative. And, you know, those aren't always the best tests. So, you know, there is a slight chance maybe he did have FIP, but, you know, it's really kind of inconclusive. There's no positive there. Also, the additional cancer test came back negative. And then the test for a UTI came back negative. So all of Boo's tests that he had, they all came back negative, which makes it even more of a mystery as to why his kidneys were so enlarged. She said that they were at least twice the size of like normal kidneys in a cat. So something happened between September when he had, his teeth extracted, and April when all of a sudden, he basically didn't want to eat anything and his kidney values were super elevated. So I don't know what that is. Now, I did ask her if anesthesia could cause something like that. And while she did say, anesthesia could be, a little bit hard on the kidneys, she didn't think it would cause, something to the extent that Boo had. She didn't think it would cause like that kind of like inflammation or anything. So she says it is a bit of a mystery. She said perhaps it might be something with him that was congenital because, over the years when he's gone for checkups, the vet has mentioned that his kidneys are a little large, but it wasn't anything like super concerning. Also, the vet has said to me in the past that some cats just have larger organs than other cats do. And when Boo had his blood tests, like his blood levels were always fine. They were always in the normal range. So, there was nothing to make anyone think that anything was, going to turn into a major problem so quickly. So it's really strange. And I absolutely hate the fact that vets don't have answers. Like, I feel like, okay, here's two cats that have passed away within like 2 months of each other, and I don't have definitive answers on either of them. All right, Simba, but Simba, you doing good? You doing good? So Simba ate some tuna today, and he had some treats. And right now he has some more little temptations, and then this is some chicken. This is some Fussy Cat chicken and gravy. And Splash ate some of that yesterday. Splash liked that. Sammy ate a little bit of that today. So what's been happening as far as Splash and Simba goes is that, if Simba's not eating his dinner, then I'm leaving food out for him overnight. And what's happening is Splash is eating it all, or the majority of it. So that's not good for Splash. So I got to try to get Simba to eat like throughout the day or during meal times, and then I could just put a little bit of snacks in the automatic feeder, so he could get a little snack at like 4 a.m., 5 a.m., so that way he's not going to vomit because he has nothing in his stomach. So you're doing good, Simba. You're doing good, Simba. You're a good boy, Simba, okay? Very good boy, Simba. So I'm supposed to be getting work done right now, but all I want to do is go ride my bicycle. All I want to do is go ride my new bicycle. It's something that's bringing me a little bit of joy after so many months of just tragedy. Look at this beauty. Isn't it adorable? It's a Schwinn. It's an Amherst. And it says 700C on it, so I think that means that these are 28-inch tires. I took it for a little spin earlier, just for a few minutes, just to make sure that, everything seems okay with it, which it does. So this was $129 at TJ Maxx, which I thought was a great deal. I've never seen a Schwinn like this before. Like, obviously, it's a retro bike. It's a really nice kind of burgundy color. It has white tires, which is really, really cool. It has a white seat, white handlebars, and it also comes with this metal basket. Now, this metal basket has a problem. You see right here, it's missing a screw. So there's a screw on this side. There's supposed to be a screw here. You see, it's kind of like it's like bent. It's like wonky. It's not right. And from here, you can see it's missing a screw here. And then overall, the handlebars are just pointed a little bit too far to the left. So because it's missing a screw and this piece is bent, I pointed that out to several people at the store. And I said, can you guys do better on the price? Like, can you give me a discount? And at first they're like, no, we can't do that. This is brand new. It just came in the store like a day or two ago, and it's going to sell really fast. We can't do that. I said, okay, well, I'm going to have to repair this. It is going to cost me a little bit of money to do that. So I was hoping you could, just come down on the price a little bit. So they gave me 10% off. So I ended up getting this bike for I think it was $117 plus tax. So it came out to $124, which is still a great deal. So I'm just going to take it for a spin. I don't know, maybe do a mile or two, not go very far. I just want to kind of, get used to riding it because it's so different from the other bike that I have. The other bike that I have is like a mountain bike. It's kind of like bigger and heavier, and this is much more of just a casual bike, just like a little cruiser. It does have 7 speeds right here, so I still need to get used to this. I think my other bike is like 21 speeds or something like that. There's still some wrapping on it. And obviously with all the white, I do expect a lot of the white to get dirty, but I just think it looks so cute. Like, it's so retro. Kind of reminds me of Pee Wee Herman a little bit. And I love the fact that it has a basket. I could just dump my stuff in the basket and be really comfortable when I'm riding. I just rode a mile and then I came home because there is a rubbing noise. Like, every time I pedal, something is rubbing. And I figured out what it is. So it's where the pedal hits this part of the frame. Like right here, it's rubbing. And like it's making a noise. I don't know if you could hear it. It's just like a little swishing noise. So this has a screw here. I'm thinking maybe if I could pull this tighter back, maybe this would sit better and then it wouldn't rub. All right, so I just actually loosened both screws. I loosened this screw here and I loosened this screw here. And then I pulled this like up and back and I tightened the screws again and there's actually a little bit of clearance now. So is it gonna hit? I don't know. I'm gonna have to test it out. I'm also putting air in the tires because these tires say inflate to 50 PSI and they only have like 20, 25. Here's Sammy. I just got back. I did 2 miles, a little bit more than 2 miles. And it's much better because the pedal's not rubbing on the chain guard anymore. So that's good. And I also put air in the tires so it just rides better. The big difference between this bike and the other bike that I have, the other bike has like the bigger, fatter, knobbier tires because it's like mountain bike tires. So I have to be careful. I was in a parking lot and it was a little bit sandy. So I had to be like really careful that I didn't slide on that because there's really not much traction or not as much as like a mountain bike tire. And then also, I went up onto like a curb and a sidewalk and there's definitely not nearly as much cushion because my other bike has kind of like shock absorbers on it. This one doesn't. So, going up and down like curbs or sidewalks is a little bit more, like you feel it. It's more rigid. So that was the main differences. But I haven't been on a bicycle in almost 2 years. Last summer, I did not get on my bicycle once. So it feels really good to be back on a bike. And it's such a great workout. Like, I just feel great, even though I only did a total of 3 miles today. I did like 1 mile with the pedal rubbing the metal. Then I fixed it and then I just did 2 miles. I could have done more, but I don't want to do too much on the first day because I'm trying to avoid being sore tomorrow, like my legs being sore. But I just realized how out of shape my legs are versus like when I'm biking on like a weekly basis. So it's early in the season. It's like the beginning of May, the very beginning of May. So hopefully I'll have about 20 good weeks of bicycling ahead of me. Hopefully the weather will cooperate and we're not just going to get rain every day. But the nice thing about this bike also is that it has fenders. So even if you're like riding around in a bit of like wet weather, it's not all going to just, splash back up at you. Hey, Sammy. Hey, Sammy. It is 7:15 a.m. Look who's by the back door. Cousin Oliver. Hey, Oliver. I just shut off the main circuit breaker switch to the entire house because I'm hearing this really high-pitched noise and I don't know where it's coming from. And I was trying to unplug different things throughout the house and it was still here. So I said, you know what, I'm just going to shut off like all the electricity. So I did that, came back upstairs and I still hear it. So I don't know where it's coming from. It might be coming from outside somewhere. Like, I don't know where it's coming from. To be honest, I never even noticed it until Grandpa Farrell was here. I don't know, like a week or so ago. And he asked me about it. He's like, what is that noise? It's like a high-pitched noise. I hear it in my right ear. And like, what is it? I said, I don't know. I never hear it. Because I have ringing in my ears. My ears always ring. So I was like, maybe your ears are just ringing. Maybe it's something you ate. Because if I eat certain things, it makes the ringing in my ears worse. Or if I'm dehydrated, if I'm not drinking enough fluids, it makes the ringing in my ears worse. So I was like, yeah, maybe it's that. But then like yesterday or the day before I noticed it, I'm like, oh my gosh, I think I hear it. And sure enough, it's in your right ear. It's like a really high-pitched noise. And I can't figure out what it is. Here's Sammy. She sees Cousin Oliver. So what happened was after I shut off all of the electric to the house, I went outside and I stood outside. And that's when I saw him. He was underneath the house. So I'm going to go give him some food now. Hello. I'll give you some food. I just gave him a can of the 9 Live Super Sipper with a few crunchies on top. I also mixed some water into the wet cat food. Make sure he's drinking enough because it's been hot during the day. He looks really good. He has his summer coat coming in. And so right now it's beautiful outside. And we're supposed to have a few hours of nice weather. Then today we're supposed to have a lot of rain and thunderstorms. So I'm hoping to get myself moving, get all the cats fed and taken care of, and then heading out on a bicycle ride today. I feel pretty good after yesterday. I mean, I had a lot of activities yesterday. I was running errands and shopping all morning and then into the afternoon. And then I rode 3 miles on the new bike. And then later in the evening, I ran some more errands for about an hour and a half. So I got a lot done, a lot accomplished, very active day. I slept great. Like I slept really, really good. I'm hoping that getting this additional form of exercise will be very helpful with that because I really haven't had time to do a lot of exercising over the past few months. Like I've just been so busy. It's been like work and deal with tragedies and cat health issues. And that's been it pretty much. So I'm hoping to be able to get outside, enjoy some sunshine and some nice bicycle riding before the bad weather hits. For breakfast today, Splash and Simba had some of this tiki cat mackerel and sardines recipe. Now this is pretty high in phosphorus. So I gave them also some of this Weruva to try, and this says it is their lowest phosphorus foods, this WX series of foods that they have. And this is chicken formula in gravy. Now, Boo did not like any of these. I bought these for Boo, because he had elevated kidney levels. He didn't like these. So I figured, well, let me see if Splash and Simba like these, because, they are getting older. You need to watch their phosphorus. And they both seem to enjoy this. So that's good. I need to start keeping a list of, which foods they will eat, which foods they won't eat. I still have a ton of food left over from Boo. See all this food? This is just some of the food that I bought for Boo to see what he would eat. And most of this, the majority of this is lower phosphorus foods. Boo really enjoyed these wellness morsels. He really enjoyed the chicken and chicken liver flavor, but I bought all the different flavors to try. These are all relatively low in phosphorus. And if a cat has elevated kidney levels, they say what you want to do is you want to try to lower the amount of phosphorus that they get in their diet. It's my second day with my new bike, and I love this bike. I can't wait to ride it today. What I really like about this bike is that it's just fun. I love how it looks. It's just such a cheerful looking bike, and it's just fun to ride. It's just a nice, casual, peaceful, fun ride. So I'm just about to head out. The goal today is to do more than 3 miles, but it is kind of hot. Right now it is about 2 p.m. It's probably the hottest part of the day, so we'll see how far I get. I have been out shopping and running errands all morning, so I am a little tired. I sat down, relaxed for, 15 minutes. So I'm going to see if I could get this ride in before we're supposed to get rain and thunderstorms this afternoon, although so far it's been a really nice day so far. But I've been thinking about riding all day, and now I'm gonna go for my ride. I just rode 4 miles in about 28 minutes, so not bad. It was a nice casual pace. It is super windy, so the wind is really kicking up right now. It's quite warm. It's probably around 80 degrees. And had no issues riding this. The only thing is I kept wishing the seat was a little bit higher. So I'm gonna raise the seat maybe a ½ inch, and then I'll see how it goes the next time I ride. It's 9:30 a.m. There was a bunch of cats looking out the window here in Boo's room, but when I turn the camera on, they move. This is the camera that they're very self-conscious of. It's been a very rough morning because a week ago at this time is when I took Boo to the animal hospital and found out that there was nothing more that could be done for him because he could not breathe and his lungs were filling up with fluid and his heart was failing. So he had to be put down. That was a week ago today. Here's Richard. And I still have Boo's favorite paper bag there on the floor. That was his favorite spot. Here's Sammy. And I feel like I did really good all week. Here's Ringo. I didn't really spend a lot of time like wallowing around in grief. And I got a lot of stuff done, and I did my best to maintain a routine for the cats and try to bring us all back to normalcy sooner rather than later. And that was much easier to do after Boo passed versus after Stella passed because for two main reasons. One, I didn't have a cat go missing the next day, like escape from the house like Sammy did the day after Stella passed away. And also because I so recently went through it all with Stella, I just knew what to do for myself with regards to self-care. Like I knew like what supplements to take. I knew to rely on the Rescue Remedy and the theanine gummies and the gingin candies. And I just took more time to do the things that I knew were going to help me as far as, keeping my vagus nerve in a more healthy and functional state than it was after Stella's passing. So this past week after Boo's passing was nowhere near as horrific as the week after Stella's passing. It also helps that it's spring versus the middle of winter. And it also helps that there's more daylight and there's more sunshine and the weather's warmer and I can spend more time outside. So that's all been very, very helpful. But today is just a sad day. Here's Richard and Nancy. It's a really sad day because I miss Boo so much. And I miss Stella. It's about 11 a.m. I just got home. I just walked a 5K and I earned this badge. I saw that it was available today and I was like, I'm really, really tired, but maybe if I do some exercise, I'll have more energy and I'll feel better. So that's what I did and I finished it. My goal was to do it in an hour or less and I did it just in like an hour. I don't know what's going on with Splash and Simba today, but they're both under my bed. So here's Simba and then Splash is in the back. Now Splash is often under my bed, but Simba is very rarely under my bed. He usually goes under the day sofa in Boo's room, but I don't know why he's under my bed today. This morning for breakfast they had some canned food and he wasn't really the biggest fan of it, but I'm still trying to figure out like which canned foods they like, which canned foods they don't like. So they had some Sheba turkey pate and then they had some Fancy Feast Seniors chicken pate. So it seems that one of them liked the Sheba more than the Fancy Feast. The other one liked the Fancy Feast more than the Sheba. But they each only ate about half of their breakfast, so I gave them each about a tablespoon of dry cat food. So I don't know, maybe they're hot today. It's starting to warm up outside. Here's Ringo. So what I realized while I was taking my walk is that another big difference between this week after losing Boo and the week after losing Stella is the amount of outside exercise that I'm able to do. Because in the winter, even though I did quite a bit of walking outside, like handing around the flyers for Sammy and all of that, it was brutally cold. Like it was below freezing and it was not enjoyable at all. Whereas now the weather has been like warm. It's been like in the low 70s, even into the 80s. It's been fairly sunny, so it's been much more enjoyable. And I really think doing the exercise is definitely helping process like the grief and the sadness and like all of those emotions. Let's take a look at my HRV status. So this is from my Garmin Connect app, and what this does is it pulls data from my Garmin fitness watch. And the reason why I got this watch was because of all the stress that I've been dealing with and all of the anxiety that I've been dealing with, like with Stella's passing and then with Sammy going missing. So what we're looking at now is a graph of the 7-day averages of my heart rate variability over the past 4 weeks. And you see all these little red triangles. This means my heart rate variability was very low. So the states of my heart rate variability is either balanced, which is the green dots, unbalanced, which is the orange squares, or low, which is the red triangles. And the goal is to have a balanced HRV. So you could see for the last 5 days, my heart rate variability has been balanced and it's been going up, which is a good thing. So if you have a balanced or higher heart rate variability, it means your body can handle stress better. And over here, where we have all of these red triangles, so this is pretty much where Boo was hospitalized, and then he passed away. So you could see that for 7 days in a row, I had very low heart rate variability, and that was an average, 7-day average. And that is a reflection of all of the stress and anxiety that I was under with regards to Boo being in the animal hospital and then his eventual passing. So I just find this really interesting because this is a good visual representation and a really good way to kind of work on decreasing stress levels in the body. Because what this is a measure of the variability of your heart rate. And the theory is that the greater variability between your heartbeats means that your body can more easily adapt to stress and recover from stressful situations. We actually started 4 weeks ago in the red also with low heart rate variability. And again, this is 7-day averages, so that red will average out like the 7 prior days. This is where I got the watch in the middle of March. And I was like baseline balanced. Now, I don't know if that's because the watch was basically just figuring out what like a baseline would be for me. I would have to look into more information as to how the watch actually figures this out. But then after, almost 2 weeks, then it went low. But this was the time that Simba was throwing up a lot and Boo was not wanting to eat. So there were quite a few stressors on me. And then here we see the last 4 weeks. So it went from low, got up to a bit of a more balanced state. But don't forget, I took Simba to the animal hospital and he was checked out. I got his blood test results. Those were fine. And, it was basically, he's throwing up because maybe he needs to eat smaller meals more often. So that was helpful there. But then, when I got Boo's blood test results and then he had to be hospitalized, you could see just what kind of havoc it wreaked on my stress levels in my body. So now I've been recovering. They say that exercise does help to get your HRV more balanced and to raise the HRV. What really helps is good sleep. This HRV is calculated when you sleep, and also just healthy lifestyle habits. So this is what I've been working on, and I'm really happy to see that it has shown improvement here on this graph. So I just wanted to share this information because prior to Stella's passing, I really didn't know about the connection between stress in the body and HRV. And I didn't even know that it was something my watch could calculate, or that this newer watch automatically calculates on a daily basis. So I just find this really, really interesting. So if you're dealing with, physical stress, physical anxiety, this might be something you want to look into to help you track that and to help you improve on that.
Thank you for watching this Lucky Ferals video. If you enjoyed it, please give it a thumbs up. Please subscribe if you'd like me to post more videos, and please make sure to check out these other videos that were selected especially for you.